not by accident the hills and the mountains are protected. And it's not by accident the city today is one of the most desirable cities.
Our forefathers and foremothers had the foresight to see the value of protecting our natural lands and having that open space buffer.
Chautauqua itself was really founded in 1898, so Chautauqua has been a part of Boulder for a very long time. In fact, the buying of the Batchelder Ranch, which is where Chautauqua is today, was funded by the very first bond issue that the citizens of Boulder voted for.
Citizens decided that they're going to protect that and grow smart. And growing smart means we're going to grow compactly. So they shaped the characteristics of the city early on.
Boulder's changed a lot since 1964. It was a fairly sleepy little town. There was no Pearl Street Mall, of course. There was little funky Pearl Street and a 5 and 10 cent store on the corner of Broadway and Pearl, and a couple of restaurants, but nothing like Frasca.
I think people said we wanted to have a well-defined community, but also what does it look like as you go up? And some people don't realize that the height limit is based on the tallest cottonwood tree that you would see. So the 55 feet is about the height of your mature cottonwood tree.
I think the open space program really reflected in the fact citizens voted to tax themselves was really an amazing milestone. And it's often forgotten the 1 cent tax for open space also included funding for transportation. Of the two things that Boulder is most known for now, one is our open space program, and that we have made such a compact city surrounded by nature, but also our transportation innovations, our bike paths, our circulator bus system. And those things are in part paid for with that original 1 cent sales tax that the citizens of Boulder put into place in 1968.
We've been working with Boulder County since the 1970s to develop the Boulder Valley Comprehensive Plan as a statement about our vision for our community's future and what we want to preserve about the things that are great, and also how we respond to the new challenges that we're facing.
The hope for the future of Boulder, it's really continuing the legacy that we've had here, that the community engagement that we've had, the people who have cared so much about this community have always made decisions about its livability. It's just such a fabulous place. It's so important for us to take good care of it.
Why should young people care about the spread of coronavirus? Well, we know that people with underlying medical conditions over the age of 60 are at highest risk, but they've got to get it from somebody.
So we're asking everyone to be selfless for others so that we can protect those who are most susceptible.
Not going to bars, not going to restaurants. It all just means physical separation so that you have a space between you and others.
For more information on how you can social distance, please go to coronavirus.gov.
Food. It nourishes, brings us together, and adds flavor to life. That's why it's important to wash hands, surfaces, and fresh produce. Keep raw meat, poultry, and seafood separate from ready-to-eat foods like fruits and vegetables. And cook to proper temperatures using a food thermometer. Enjoy! And refrigerate leftovers within 2 hours. For more tips on safely preparing foods, visit homefoodsafety.org.
everyone on but Mary. Is that correct?
And Aaron here, I'll just encourage people to use the background blur feature too, which is nice so we can focus on each other's faces and words.
As of today, I don't have access to that.
Okay, no worries. For those of us who do, it's in the little 3-dot button in the toolbar. Blur background feature.
Hi, who just joined us on the phone?
This is Shay. I couldn't get the live stream.
Great. Thanks so much, Shay.
Thanks.
Is Mary on yet?
Mary does not look like she's logged in just yet.
Chris, I wonder if somebody wants to call Mary on her cell phone and see if she's having technical difficulties.
I will go ahead and do that.
Okay, great. Chris, if you can do that, that would be great. I'm going to go ahead to do anything as part of getting started.
No, I think we are good, and we're ready whenever you are.
Okay.
Chris, I'll call Mary.
Okay, great. Thanks.
Okay, great. I'm banging the virtual gavel here and welcoming everyone to the Tuesday, March 24th, 2020 special meeting of the Boulder City Council. We have a lot to talk about, and I want to take just a moment to say a few words, but let's start with the roll call.
Councilmember Brockett.
Present.
Friend.
Here.
Joseph.
Present.
Nagel.
Here.
Swetlick.
Here.
Wallach.
Present.
Weaver.
Present.
Yates.
Here.
Young. Mayor, we have a quorum.
Great. Thank you very much. I will remind everyone to please mute your microphones when you're not speaking. I've been getting some feedback once we got more people on the call. So I think we're going to maybe have to remind ourselves of that a few times going forward. These are difficult times for everyone. And so I want to appreciate the work that's being done by staff, by council, by our journalist community, by our medical community. The list could go on and on, but everyone is chipping in. And it's been helpful. So, you know, I've heard a lot of positive things from folks about how the response is going. So anyway, that's just a quick kickoff. Can we have a motion to approve the agenda as amended?
So moved from Bob.
Second from Mark.
Does anyone object? Hearing none, we'll call that an 8-0 vote to approve the agenda. Then next, there will not be public participation tonight because it's a special meeting. If we have one on March 35th, that will be similar. It will be a special meeting and there won't be public participation. However, city staff are actively working to provide for remote public participation beginning with the April 7th regular meeting. We will make sure more information gets out. It will be on the website where the agendas are and maybe in the coronavirus information as well. So we are actively working on making April 7th a regular meeting with public participation. Just a reminder to everyone, this meeting is being televised on Channel 8 and live streamed at boulderchannel8.com. So with that, I would ask, does anyone else want to make a statement before we turn it over to staff? Great, hearing none. Jane or Chris, would you like to take it away?
Yeah, thank you very much. So we are going to be starting off with a COVID-19 briefing. And before we get started with that, let me ask each of you to do us a favor. There'll be several speakers tonight, and of course, Jeff Zayak will be the first one. Please hold all of your questions until after the person has completed their presentation. It will make things so much easier for Chris, who's trying to orchestrate all of these presentations. So we'll start off with Jeff, then Rob Vissers from Boulder Community Health, and then I will introduce a number of staff members that will make a presentation with regard to the things that the City of Boulder has been doing. So let me get off for a minute and ask Jeff Zayak to take it away. Jeff?
Hi, Jane and council members. Thank you very much. Can you hear me okay?
Yes.
Excellent. Thank you. So my name's Jeff Zayak. I'm the Executive Director of Boulder County Public Health. Let me start off by just giving you an update with where we're at with our numbers at this point. And these are numbers as of 4 p.m. today. So we had 912 total cases in the state out of a total of 7,701 people tested. So that's about 11% of individuals that are testing positive for COVID-19. Of those, we've got about 84 hospitalized cases out of a total out of that 912. So that's roughly 9% of individuals that are positive have been hospitalized. The cases that have been identified in 35 counties out of the 64 counties in the state. 11 of those total cases have been deaths. And so that's about a 1% fatality rate. And that tracks pretty closely to what we're actually seeing happen in most of the other nations as well. So we're not significantly different. The one thing that has been different for us is the percentage of people that are under 65 that have been hospitalized, and that is roughly 70% at this point. And that is different than what we've seen in other countries at this point. So Boulder County cases specifically, and this is as of 9:30 this morning, so a little bit earlier, 46 cases total in Boulder County. And I think what's important in all these numbers for council to know is that the best estimations at this point are that because our testing in the United States is not at the same level that it has been in other countries, we are underestimating the total number of cases. So the best estimations are 50 times the number of cases that we are seeing as identified positives. We actually have people in the community with the virus. So if there's 2 cases, you would multiply that. Each of those cases you would multiply 2 by 50, and that's the actual number of people that would be in our community that are likely to have this virus. So we know based on testing that we're underestimating cases, and our cases breakdown in Boulder County are 28% of the actual cases that we are seeing are in individuals that are 19 to 29 years old, 44% are in individuals that are 30 to 59 years old, and then 28% are in individuals that are 60 years of age and older. And one of the things that I want to keep making sure that I'm repeating is that we know that still 80% of the people that get this virus are going to have very mild symptoms. 20% of the cases will be more acute symptoms, and of those 20% of cases, we are seeing that fatality rate hold around 1%. The virus, obviously, if any of you, I'm sure if all of you have been following it at the national level, the virus is to be taken extremely seriously. But we want to remind people that most people are going to recover from this and are going to be okay in the long run. The hospitalization rate across most of the other places that we've looked at has also been maintained around 10%. So again, we're pretty close to that rate here in Colorado. So the biggest thing for us is that testing continues to be a really significant constraint and challenge. And what we've seen in other countries that were successful really holding down the surge of cases, which I'm sure you've all heard a lot about, is that they've been successful because they've been able to effectively test, identify the number of cases that are out there, and then isolate, quarantine people who have either tested positive or who are presumptive positives so that we can control the spread of the disease. And that's been extremely difficult for us here in Colorado. We have been working at the state level to try to expand that testing. There has been some expanded testing that's happening already, and Denver has been successful at that. There's also been some outreach to our hospitals across the state to continue to expand that testing. Ideally, what we would like to be able to do is to be able to not just test and get more positives and identify people who actually have the virus, but then do a better job at actually controlling some of the cases so that they are not exposing other people. And if we can continue to move towards that as we come forward in these weeks, we still have the opportunity to control this case and to control these cases and to lower that threshold of surge both within our community and within the state of Colorado. The other thing that I wanted to make sure you're aware of is that our personal protective equipment continues to be a challenge. You've probably seen with the governor's orders over the last few days that he has asked a innovation task force to be formed. One of the purposes of that task force is to try to generate our own supply of PPE in the state. He's put several people together who are from different industries to think about that. Because we are fairly certain at this point that we will not see a response from the federal government that would require manufacturers to work together to get us our own supplies across these states. So we know that we are going to have to work on that ourselves, and that is an area that we will continue to focus on and work on. Let me see. Let me talk a little bit more about where we are headed as we come into these next weeks. The first thing I wanted to mention is that that we've been working closely with Jane and with Tanya at the city because you move forward your emergency order. I am very appreciative that both Tanya and Jane have worked closely with Boulder County Public Health to do as much as they can to align with the order that we will eventually be putting out in the next 24 to 48 hours. And that's really important for a few reasons, but one of the reasons is if each of us move forward with our own orders and we weren't being consistent, it makes it extremely difficult for us to be able to enforce those orders across our jurisdictions. And that's that we've been taking at the metro level with several of our regional folks in counties that surround us. We've been working diligently to try to make sure that as we move these kind of stay-at-home orders forward, that we are being consistent in terms of the language that we're using. We are being consistent in terms of our approach, because we know if we have people moving across jurisdictional boundaries and we're not, that it's easier for the virus to spread. So we've been spending a lot of time focusing and thinking about that as we move forward here in Boulder County and in our surrounding counties around us. So that's a lot of information. I will talk a little bit more here about where I am seeing the hospitals at this point, and I think Dr. Vissers will be on the call, so I don't want to get too far in front of him. But one of the things that we are hearing that is a challenge across the nation, and we are hearing from the Colorado Hospital Association here, is that they are working to prepare for a surge that would happen in the next few weeks in front of us. And the best predictions at this point is that that surge and the peak of that surge is going to fall anywhere between the end of April and the end of May, depending on which predictions you look at and what kind of social mitigation strategies you put in place. So I know that one of the concerns that we're focused on is just checking in with each of our hospitals on a weekly basis to make sure we know where they are. We are set up and ready to implement an alternative care facility if they need it to support surge. And I know the hospitals themselves have been working diligently to think about how they increase their capacity at a statewide level with the Colorado Hospital Association, who has talked pretty closely with some of the other states that have already gone through this. So I'm going to stop there. It's a lot of information, and see if there's any questions for me.
So Jeff, this is Sam. I have one question on the queue from Rachel. Rachel, you want to go ahead?
Yep, thanks. Thank you so much for that information. Can you hear me?
Yes, thank you.
Okay. So I had not heard that our hospitalized cases were a higher percentage of youth or people under a certain age. Did I get that right?
Yes, about a week or so ago, the latest research came out, and it was from CDC, and they had publicized it and said that 69% of the total hospitalized cases were actually in people that were younger than 65 years old. So that is a little bit different than what we've seen at an international level, and it is something that had concerned us here. And if you look at the cases that came from Eagle County as an example, it's consistent with what they were seeing in the surge that was occurring in Eagle County as well.
So that's concerning to me because I think that in general, younger people have maybe taken some of the measures less seriously. So I don't know how we're addressing that, but hospitalization would mean that they're having a very serious reaction to this virus, I trust, and that's just concerning. And I wonder also if we have any explanation or theories on it.
I wouldn't want to ponder a theory because I don't have that level of expertise, but I can tell you that we have, I think you're all aware that we have a joint information center that is set up, and it's between and across our county and all of our municipalities, including the city of Boulder. And we have adjusted and are making sure that as we get new information, we are adjusting that in our communication strategies as well. And they go out in multiple places, social media. So we are adjusting as we're seeing new research and new information come out. And we're constantly trying to target and make sure that we are focusing on getting to the people who are most impacted with this, and that they are aware of what that latest research looks like.
Great.
Thank you.
I have 3 people on the queue. Aaron first, then Bob, then Mary.
Great, Jeff, thanks very much for this information. Quick question, when Boulder County issues its declaration, will that supersede the City of Boulder's? Will it also apply in the City of Boulder? Is that only unincorporated and non-home rule cities?
It would supersede the City of Boulder's only in places where our order is the same or more stringent. So, for example, if the City of Boulder has a more stringent provision than what our order is, the City of Boulder's provision would hold in that case.
Gotcha. Thank you. So, but it will apply countywide, in other words?
Yes, it will apply countywide across municipalities, towns, cities, and within unincorporated county.
Thanks very much.
Thank you. Bob, next.
Thanks, Jeff. Just one question. Based on either our experiences here in Colorado or experiences we've seen in other states with high infection rate, how long is the average hospitalization stay? Are we talking days or weeks? Do you have a general idea?
I am not positive, and I don't want to venture a guess. I've heard some guesses, but I don't want to venture a guess. And I'm guessing if Dr. Vissers is here, and I'm not sure if he is or not, if he could address that question directly based on what they're seeing within Boulder Community Health.
Right. And if that question can't be answered tonight, perhaps in future briefings we could bring that back.
Absolutely.
So, Bob, I think I might be able to answer that quickly.
Is this Vissers?
This is Rob Vissers. Yeah.
Okay, thank you.
So at least from what we're hearing, it's approximately 3 weeks. Obviously, it's much longer for people that are critically ill. Some of this is also waiting for the patient to be negative, which leads to some comments I'll make later about the importance of having convalescent places for people to decompress the hospital. But at least in the model, so when we're trying to look at modeling for what our peak will be, they've been using a number of approximately 3 weeks. And if you're in the ICU, it's about 10 to 14 days.
Great. Thanks, Rob.
In just the ICU, and then plus additional days on the floor.
That's real helpful, Rob. Thanks so much.
Okay, and then we have, and sorry, I'm going to be doing this back and forth between council members and staff. We have Mary, and then Jane, and then Mirabai.
Thank you, Jeff, for that. I appreciate it. I have actually 3 questions. One is in response to receiving some comments in today's emails regarding why are we taking such drastic actions. Do you have any data and or charts that can illustrate the trajectory that we're on? And how might we be able to access them?
Yes, I can send that as a follow-up, and Tanya may actually have that already as a follow-up from the meeting that occurred today with all of our city towns administrators. We are looking at projections that are the best projections. They are specific to Colorado, and then you can look at every other state in addition to that. And so that is a lot of the work that we are looking at. In addition to that, we are meeting with the state health department multiple times a week. And the state health department is looking at updated models. So they are taking the latest information that's happening across the nation and looking at that and plugging that into models to look at what is the best prediction that we have based on what we know at this point. And that changes, obviously, from week to week and day to day even sometimes.
Thank you. I think one of the things that would be helpful there, if you can provide it, would be the slope of the trajectory, because that, and the slope as it compares to other states and or countries. I think that would be really helpful. So thank you for that. My next question is regarding to what kind of data and information we have that relates the adhesion to social distancing with respect to the fatality rate. So in other words, the more, how do more stringent orders for social distancing affect the fatality rate?
I have not seen specific predictions that are relative to social distancing and the fatality rate. What I've seen is predictions of social distancing on how you would knock down the total number of cases. And then what is being extrapolated that I'm aware of is the percentages that we actually see in terms of fatality rate in different places. So there's not a prediction exactly to the fatality rate, but there is a prediction of these social mitigation measures can affect how fast the curve goes up of the surge and how long the curve lasts, those kinds of things.
Thank you. That would be helpful information, and then to staff to put it on the website so that people can, so that council and other folks can access it and refer to it easily. My next question is about information. All of this information that you're presenting to us, can it be made available in languages other than English, specifically Spanish, as there, I'm seeing that there's, I would like to thank staff, City of Boulder staff, for working really hard to provide bilingual information. I'm seeing a real dearth in other areas, and so I'm interested in learning where that information might be found and or if that information is being created.
I can only speak from what I know about our own system, and I can do a follow-up on that for you where I don't know the answer. But in our own system, we are definitely incorporating Spanish. So I know that's happening through our Joint Information Center, and that is being thought about as messages are going out. And we are also thinking very specifically about where we want to get those messages to in our communities to ensure we are reaching those populations specifically.
Thank you very much. Appreciate that.
Got it. Okay. And then after Mary, we have Jane and then Mirabai.
Thank you. So I just wanted to provide council with a bit of information related to Jeff indicating that the Boulder County Public Health will be issuing their order tomorrow. We have been working closely with them, and our intention is that tomorrow we will amend our order to conform completely to the Boulder County Public Health order so that it will be seamless throughout the county. So I was going to tell you that a little bit later this evening, but a question had come up about it, and I wanted you to know early in this meeting that that is something that is going to happen. So thanks.
Great. And then right now I've got on the stack Mirabai and Mark and Junie. And before I get to them, Aaron has a colloquy for Jane.
Jane, thank you for that. Just, I I know one of the potential topics for discussion this evening is how we might change our declaration a little bit in response to feedback. Are we still thinking about doing that, or are we saying, well, actually, let's wait for the county and conform to what the county does?
What we actually would prefer is that we wait to see what the county does. Some of the questions that have come in today are going to be answered by the county's order. So waiting would be better. Tom has prepared a really quick 2-slide presentation for us to talk about if you want to go in that direction. So we can address specific items if you need to, but a lot of it will be covered in the county's order. So I'd rather wait.
Okay, thanks. We'll talk more later, I'm sure.
Okay, great.
Yep. So Mirabai, and then Mark, and then Junie.
Hi, and so thanks everybody for all their hard work. It's really appreciated. I think it's great how we're all pulling together. I don't know if this is for Tom or Jane, but my question is regarding enforcement. So, I know we've had a lot of complaints and issues with CU students. And so I'm curious how enforcement, I'm assuming our police officers are probably stretched pretty thin at this time. So I'm curious how that's going to be handled with something like that versus someone trying to go to work who might still be open and just have different circumstances and are able to go to work and still plan on going to work. So, I mean, if you could elaborate on that, that would be real helpful.
Sure, I can go on that one. So our plan is that our police can't be enforcing every person who might be out on the street. And so just like what Mayor Hancock said yesterday, and I think the governor did as well, is that we intend to enforce this a lot through education and encouragement. And certainly if a police officer were to see somebody, or a park ranger were to see somebody violating the order, they will comment to them that there's an issue, but we won't be arresting anybody and probably not issuing tickets unless we have somebody that is a constant person who's violating the order. So our intent is to be educational and encouraging more than anything else.
Perfect. Thank you guys very much.
Great. And then next I have Mark and Junie on the stack. So Mark.
Jeff, thank you for that presentation. It was very helpful. When you model out to the peak period, what's the relationship between the number of patients expected and the number of beds available and the number of hospitalized individuals and the number of respirators?
So the only correlation on the models that I'm seeing is the total number of patients that would be a surge to the hospital, and that does include beds as well. But I have not seen anything that would get towards the ventilator piece of that. So again, the model has been put together specific to every state in the nation. And I know, again, that if Tanya doesn't have it, she'll have it shortly tonight from our folks, and that could be put on the website so people could take a look at that for themselves as well.
Thank you.
Great. And then we have Junie.
Yes, I had the same question as Mark, actually. I wanted to know the number of beds, and because we've received a lot of questions from community members, some who are not very happy with some of the decisions that we've made as a city. So my question was the number of beds that are available and the number of hospital that is within the county, within Boulder County. And if you could have that available for us as well on the website. And also what I was thinking, if you can give a little bit more clarity on our communication when it comes to county population, because you talked about peak. And I think a lot of our community members, they don't fully understand what that means. So I think maybe some communication about the number of hospitals, the number of beds, and when it comes to peak, you just mentioned peak modeling. What would that mean, a surge of the virus for the city of Boulder or the county itself? I think that would be good to look at our infrastructure.
And I can respond to some of that. So we don't have anything that is specific to Boulder County. My guess is Dr. Vissers may be able to talk more specifically about what that might look like within our county, but we don't have modeling that breaks it down to our own county. It's only a statewide model that is available at this point. We can definitely provide you with more information about the hospitals that we have in the county, where they're located. We do work closely with those hospitals and talk to them on a weekly basis because we are charged with making sure that we stand up a alternative care facility if the hospital reaches a surge point where they can't handle the amount of people that are coming in. So we are in close contact with them, and that situation changes on a weekly basis. But we don't have any kind of modeling that we would be able to project for you for Boulder County specifically.
Okay, Junie, is that good for you for now?
Yes.
Okay, Jane?
Yeah, a couple of times folks have been asking for the data that Jeff is talking about, and we do have that data. He provided it today in a phone call to all the administrators in the county. And so we will put that up on our website or a link to it tomorrow. So that will be available tomorrow.
Great. And Jane, will that be countywide information?
I believe that it is countywide information, yes.
Great. And one follow-up question that I have on this is when I went on the Boulder Community Health website, it helpfully provided that there's 168 staff beds, 92 acute care beds, and 12 ICU beds. And so I guess my question would be if we can have that breakdown either by each hospital or just countywide so that we have some sense of ICU would be great.
Great, thank you. I know that that data is available, and so I'll work with Chris and Tanya to see how we can get that up there.
Okay, super. Who's up next?
Oh, I think we're ready for Rob Vissers, if no one has further questions for Jeff.
Thank you, Jeff. Much appreciated. Rob?
Thank you, Jeff.
Absolutely.
Great. All right, I'll go ahead. I did note some of the questions you had, and I might be able to answer some of those questions as I go through the presentation, or I'll try to, at least either specific to our hospital, but also I'm pretty engaged with the Colorado Hospital Association and efforts at the state level, so I might be able to provide some context as well. I guess what I would start with is that we feel like we're doing very well in terms of our preparation and our contingency planning. What I'd like to do is give you an update on what we're calling 3 Ps, people, so how we're managing and the safety and our patients and our testing, the product or PPE, the equipment, and finally place where we're going to be able to put everybody, and that speaks to the bed question that you talked about. I also want to start with a heartfelt thank you. Last week we talked about the importance of flattening the curve and reducing the spread of the disease, and how critically important that is to us and our ability to save lives. And the actions that have been taken by City Council, by Jane, and by Jeff, and Boulder County Public Health, I think, and we all believe, will make a tremendous difference. And for all the people here that are working 24 hours and expect to have a very challenging couple of months ahead, it's very heartening, and it's very supportive to see that all of you are taking this seriously and taking the right action. I may be able to speak briefly to when we talk about the peak, and the peak is at the point in time where the number of cases has sort of hit its top number, and then after that, for every case that is positive, there is 1 or less new cases, and so that it starts to drop. And for us, really, the peak or the surge is what is the highest number of patients that I'm going to have to take care of in my hospital at one time? What is the highest number of people that I need that needs a critical care bed, and what's my maximum number of ventilators? And when you hear that patients are in the hospital for 2 or 3 weeks, you can see that they're going to start to accumulate as well. And so you end up with, and the challenge is if our capacity is below the peak of that surge, then that clearly is going to cost people's lives. If we don't have the critical care, the ventilators, and we're having to make decisions, that will clearly cost people's lives. So I think there's good evidence that if we can do anything to reduce the slope or the surge, ideally we want less people infected, but even if we can spread it out over a couple of months instead of a couple of weeks, then that greatly enhances our capacity. I would also say that the efforts statewide from the hospital point of view have been really to increase that capacity. How many critical care beds, how many ventilators, but also what's important is how we can get patients out of the hospital. So if everyone's taking 3 weeks in the hospital, we're not going to have room to take new patients in. And so there's been a lot of work done to move patients to convalescent units or step-down care facilities outside of the traditional hospital setting so that they can recover. Even though they're well, they may be positive, they may not be able to go back to the skilled nursing facility or the nursing home, but they're occupying a hospital bed and they're otherwise healthy. And so there's been a lot of great work going on between the Hospital Association and the state and the governor's office to try and establish some of these places, including looking at hotels and dorms. So again, thank you for your efforts. I do believe, and certainly my staff believe, that it will make a tremendous difference. So let me start with our testing specifically. And so the numbers here are going to be different than what you've heard from Jeff's. Jeff's numbers reflect Boulder County residents, regardless of where they were tested. I can speak to the tests that we've done at Boulder Community Health. Again, these are sent out. And that's been a challenge. We're not getting results back. It's taking 4 to 8 days. Yesterday, there was a couple-day period where we weren't getting any results back. So it's very difficult for us to answer questions like, what does the slope look like? What's the doubling time, or things that we would use for modeling because we just don't have the data to feed into the models to get a sense of how quickly things are accelerating. One marker is the people that we know who are positive in the hospital. So we know how many people are sick from this, or at least we're trying to rule out. We have we've done 450 tests. 130 are still pending. We've had 288 negatives and 32 positives. So far, we've only had 3 positives that have required inpatient care. One has already been discharged, and in fact, the result came back after the patient was discharged home. Fortunately, the patient was treated throughout the entire stay as a presumed positive. The patient's doing well. We have 2 inpatients now that we know are positive, and we have another 11 patients that we are ruling out. And these patients are cohorted in a COVID unit that we were able to build by reducing some of our elective surgical and other elective volume. We have screened 88 employees. And you're going to see that we have a higher rate of screening for employees because when the testing became limited, we ended up prioritizing employees so that we could get them back to work, as well as hospitalized patients. 48 of the tests we've gotten back, 48 are negative, 2 were positive. Of the 2 employees that were positive, 1 is already back at work and the other individual is doing well. We feel strongly, the strong likelihood is that they were infected in the community, likely through travel, not at work, based on when they developed the symptoms. Right now, our census is low, actually, and so our efforts to keep people out of the hospital and the emergency department are working. We still have the 3 urgent cares that are screening patients, and we also have our clinics are all operating, but we've been able to do a lot of our care telephonically and through video conferencing, and so that really has taken a lot of the burden off our acute care facility. And right now, we're in a good place to accommodate the surge and the beginning of the surge. I'll speak in a minute about our total beds. Before I get to that, I'll talk about where we are in terms of supplies. We're actually doing pretty well. We were fairly active early on and having a daily monitor of our supplies, taking action to make sure they were preserved. We have right now approximately 118 days of surgical masks, which is the mask that most people need and would be using. That may decrease if our number of COVID patients goes up. However, we're employing a number of techniques that allow us to use the masks, at least for the providers, over several days. We're exploring sterilization of masks and other things to extend the life. And we do have some word that on the horizon we should be able to get some more of those. Our N95s, we have 90 days supply. Where we're really struggling is disposable gowns. So we're looking for alternatives. Otherwise, we're actually in pretty good shape for that. And we're part of a statewide reporting that lets everybody know how everyone's doing in terms of their supplies. And people have been very good about sharing information. So overall, feeling pretty good, at least certainly compared to other parts of the country and hospitals in terms of our personal protective equipment. Our employees are being extremely thoughtful and responsible. In terms of people, right now we're not experiencing any staffing shortages. In fact, in elective areas where we've been able to cut back employees, we've been using them to reduce the overall shifts of our employees, to create a deeper bench for when the surge occurs. And we're also using this time to train employees so that they have skills to accommodate and support what we anticipate to be more intensive care and critical care patients. Continue down here. In terms of our capacity response, what we heard from the governor's office as well as from the Colorado Hospital Association is based on models. Their best prediction is that we will need approximately, at the peak surge, 5,000 critical care beds across Colorado. Right now we have approximately 1,400. These are 5,000 additional beds, but all 1,400 often aren't being used for ventilated or respiratory patients, and obviously less of them will be needed for elective surgeries that are canceled. However, the feeling is we probably need 3 to 4 times the ICU beds than we currently have in Colorado. I don't have a ventilator number, but I think we all expect that we'll probably need at least 3 to 4 times as many ventilators as well, if not more. So when you look at numbers of beds in the county and what the hospitals have, I would caution you against the reported numbers. So those reported numbers, although those are approved beds, but many hospitals aren't staffing that many beds. So a facility like Longmont United that has a lot of beds but a lower census probably has a lower number of staff beds. The good news is they have the capacity to increase. Although we were licensed at 179, we have received approval from the state to go up to 230 beds. And if we can find a way to increase our capacity, there's a willingness to increase our licensing as well. We have mapped out a tiered response depending on how many patients that we see. And right now we feel like we could comfortably increase our intensive care beds from 12 to 57. So this is a 4 to 5-fold increase. And there are other possibilities that we could beyond that, but we feel comfortable that we could achieve the 4 to 5-fold increase that's being anticipated. We also feel like we could increase our ventilators in a similar amount, although some of these are ventilators that aren't traditionally used as ventilators, anesthesia machines, modified CPAP machines, et cetera. But having said that, we have found a way to significantly increase from how many patients we would normally be ventilating, which is usually 4 or 5 at a time, up to the mid-30s and probably beyond if some of the other things we're exploring come through. The other, we've been able to, we anticipate we'll be able to double our acute care ED capacity, and we can probably double our medical bed capacity. One of the challenges with the medical beds is that people are still going to be having babies, so they're still going to need the other beds that we have set aside. And some of those critical care beds are converted medical surgical beds. However, we think we can probably double our capacity as well over our tiered response. The most important thing, I think, what we'll come up against isn't just the number of critical care beds, but our ability to move patients out of the hospital. And that's where some of these secondary sites for low acuity patients who are convalescing, recovering, waiting to be negative and non-infectious so that they can return to the home environment or the skilled nursing facility. That's where the state, the Hospital Association, and other organizations are exploring to create that ability to move patients out of the hospital and create capacity for us to take in new acute patients. But there's a lot of excellent discussions going on there. I can tell you the governor's office is completely in tune with this. They've demonstrated a very strong leadership throughout all of this with weekly and biweekly communications and strong collaboration with the hospitals and the Hospital Association. So that's been very positive as well. I guess the last thing I would close with before opening up to questions is probably one of the things that has been most heartening and has made me believe more than anything else that we in Boulder will come through this okay is the incredible outpouring of support from the community, whether it's just kind words, whether it's the thoughtful, proactive decision-making and actions of City Council, or the incredible number of people donating equipment, supplies, ideas, food, and I can give you some specific examples that are incredibly heartwarming. And but I can tell you that this community has been tremendous in its support, and that will be a key factor as well in our ability to get through this as safely as we can. So I'm going to stop there and take any questions that you might have.
Dr. Vissers, this is Sam Weaver here, and I just want to say on behalf of all council, city staff, our entire community, how wonderful it is to have such a outstanding health organization to help get us through this. You know, your ability to rattle off the numbers that we'll be able to potentially increase our capacity if we need to is very reassuring. It says that maybe we can get through the surge. We'll have to continue to monitor, but you're pretty well ahead of, I think, the steps that need to be addressed to think it through. So I just want to say thank you very much. And on that note, we have a question from Mary.
Yes, thank you very much, Dr. Vissers. Appreciate all that information that you just shared. And I want to strongly echo Sam's sentiments. We definitely live in an extraordinary community willing to pitch in. And I hope that we can get through this scathed, but fairly unscathed. My question has to do with, I understand that Lions, Colorado has redirected its short-term rentals to help with recovery beds. Is that something that would be helpful in Boulder?
I think anything we can do to decompress the hospitals is helpful, and we've already seen a positive impact with the efforts on the pre-hospital side. You know, keeping people at home and keeping them from coming to the emergency department. As we fill our hospitals, our challenge will be getting those convalescing, recovering patients out. And now, having said that, those efforts are probably best coordinated through public health, the governor's office, and the Hospital Association. We'll do whatever we can to support these efforts, but I expect that our staffing will be constrained to the acute care, and so we may be, and I know the efforts are going on at the state level to try and support this. I reached out to Phil DeStefano last week and asked him about the dorms, and he said, I'm already speaking to the governor's office about this, and we're working on it. So that's great. If they're doing that, other people have talked about hotels. I would reach out to the state and the governor's office to see how they can help support those efforts.
Thank you very much, Dr. Vissers. Just a quick question about, I failed to write down, you said that there were estimated 5,000 critical care beds and that we have 1,400, is that correct?
That was the estimate that was given to me last week from the Colorado Hospital Association and also from the governor's office, is that our baseline is 1,400. And now not all critical care beds are created equally, but in general, that's the number being used. And I would imagine those would be easily used. But the estimate was we would need we would have 5,000 extra cases at the peak. All 1,400 aren't occupied all the time, and usually far less than that require a ventilator. But that's a general ballpark, and the estimate is that we will likely need 3 to 4 times the number of critical care beds than we are currently have in Colorado. And so we've been targeting 4 to 5 at our organization, 4 to 5 times the number to accommodate the potential surge.
Thank you very much.
Great. I have no questions on the queue. Jane or staff, do you have anything you'd like to add?
No, we don't. We're ready to go with the next part if you'd like to do that.
Great. Well, again, thank you, Dr. Vissers. Hang on. I just got one from Bob Yates. Bob, go ahead.
Yeah, this is probably as much for Jeff as is for Rob. Jeff, before you jump off the call, are there other things that you want us to be doing? We obviously have our order in place, but are there other things that you need us to do? We'll probably be reconvened here in 7 days, but in the next 7 days, is there anything that we haven't done that we should do?
Thank you so much for that question. I appreciate it. The City of Boulder has been incredible, and I think the most important pieces that we can work on together as we move forward into these next 7 days is to support the education around these orders. If you've been out and walking around on the weekends, you probably see that there's still a lot of people out gathering in different places, and that is clearly where our focus will be for this next week, is to make sure that people understand of following some of these mitigation efforts, and where they are out to follow that social distancing is going to be a huge piece. So we've been working really closely with our Joint Information Center on that, and the city has been very linked into that process. So our work together to help support those things across all of our municipalities is going to be, I think, the biggest work that we have in front of us for the next week.
Great. Thanks, Jeff.
Yeah, I don't really have anything to add. I think the ability to communicate with you, because the words we say are showing up in the paper and in other places. So the opportunity to inform you is also an opportunity to inform Boulder. So thank you for that. And again, just reinforce that these stay-at-home efforts really do make a difference. And I know that sometimes you're challenged with the decisions you make. And if you need support from Jeff or I in terms of numbers or what it means to us as providers and caregivers, we'll be happy to do that. I can tell you last night I rode my bike home, so I was coming from the hospital, so it was essential. And it was about 8 at night, and it could have been 3 in the morning. I saw 3 people that were walking individually and hardly any vehicles. So I do think Boulder is taking it seriously, but the more we can reinforce that, that'd be great.
Great. And then I have Mary on the queue.
Just I wanted to follow up on last week's question, Dr. Vissers, regarding information in languages other than English. And if you can direct me toward where I might find resources on your website. I understand that you do have Google Translate, but a direct translation is most helpful.
Well, a direct translation is most helpful. The challenge is that we are having to update that information 2 or 3 times a day. And so it's been very difficult for us to keep the direct translations consistent with the most recent information. I have heard that the Google translation is working pretty well. We do have some internal documents, like some things that are much more less likely to change day to day. I suppose we get a lot of outreach from the community to help support our translators are working very hard just to try and meet the needs of the patients because now they're all remote and telephonic. But if there's a community support to help with the ongoing translation, that would certainly be welcome.
And I was going to offer something like that. So I'll see what I can find out there. And I definitely appreciate that the information is changing rapidly and it's hard to keep up. I would also appreciate a link to where that information is. So thank you for that.
Great. And then this is Sam here. I have one quick question. We've had some folks who very much want to volunteer to manufacture surgical masks and other PPE. And I just wanted to get your response to that versus what you currently have versus what you think we might have access to as the larger medical community ramps up manufacturing.
So I'm happy to address that. This is Jeff, and we've had lots of similar requests from people who want to just help. They want to help by making masks. I'm not sure if you're masks associated with people who are wanting to do that themselves or if that's an actual manufacturer. But in either case, what we're doing is we're linking those people directly into the state health department. Masks and PPE have to meet certain standards in order to make sure they can be used in these types of scenarios. So any of those requests that we get, we filter into our system and then filter it directly to the Colorado Department of Public Health and Environment to evaluate.
Perfect. That's
I might be able to answer a little bit there. We really appreciate all the efforts, and it is helpful though if we know that they are at least meeting some of the similar standards to the surgical masks. We're coordinating this through our volunteer services. So if they reach out and connect with our volunteer services, and there's been so much response there that we do have some recommendations. But also I know the Hospital Association has been managing this, and they have at least they've said they have online description of materials that are appropriate and how to make them. And they're looking at actually getting the materials together, creating these kits, and then sending the kits out so that people can sew them. So this may end up representing an important way for us to continue to protect ourselves and our employees.
Okay, very good. Does anyone else have any questions for either of our health experts? Hearing none, I will say thank you again. And Jane, if you want to move us along to the next agenda item, that'd be great.
Yeah, thank you. So what we're now going to do is a city update of what's been going on at a pretty high level from the last week. A couple of us are going to be speaking, and just let me remind you again that my part is very short, but when Kurt starts talking, please let him finish his presentation before asking questions. So on to the next slide. A thing to remind you and the community about is our guiding principles in this response. During the 2013 flood, we also created guiding principles, and it's always good to be reminded at every meeting what we're trying to do here. And of course, the first one is to preserve the healthcare system. And both Rob and Jeff talked about that, and that is one of the primary motivations for why we passed the emergency order yesterday about staying at home. It's really key. Obviously, we want to ensure the continuity of government. And another key effort for us is to focus on equity, to make sure that all community members are included and treated equally and well throughout this crisis. We have several response teams that are operating in the city right now. We operate on a daily basis, and we're trying to make sure that we have effective communication across the organization and with the community, ensure continuity of operations, work with our partners to meet emergency needs, and equitably care for the employees in the community. Next slide. As I indicated, we want to focus on essential services. And just to be very clear for our community about what those are, they are law enforcement, which include police and the OSMP Rangers, our fire and rescue, our water, our wastewater, our transportation access, and our citywide COVID response team. So other essential services that will pop up are Parks and Rec Forestry. So that came up when we had the snowstorm a few days ago, and we had some trees down, and so they went into action. We also have our Planning and Development Services right-of-way inspectors, and they are working on emergency aspects of right-of-way, and our building inspectors are working only in emergency situations. And then we've got our internal operations, which are really supporting the city manager's office and everyone in the city to make sure that things operate smoothly. So on to the next slide. Another important aspect, and I think Mary's been talking a little bit about this, is our communications. We are trying very hard to make sure that all of our communications are timely and that they are in both English and Spanish. Every day we add new resources to the city's website, and some of the things that you asked for last week, we have added this week, and we tried to add them as quickly as possible. So these were things about senior shopping hours, and a lot of our grocery stores and pharmacies have really stepped up and added those. We have some information about financial assistance, food assistance, and business resources, and a lot of frequently asked questions. And we try to put the most recent questions first so that people don't have to scroll through everything to get to their answer. Our video services is producing weekly COVID-19 news in both English and Spanish, and several of our council members have also produced videos in English and Spanish to update the community. A thing that's interesting is that traffic to our website is up 58% from the average, which I think makes sense. And 53% of all the city traffic is going to the COVID-19 site. We've had lots of likes and shares and comments on our social media posts, so that we think we are really getting the word out to the community about what we're doing. So I think that's my part of the presentation, and we will be talking about communications at the very end of the city presentation, but I think very important for you right now is to go through our homelessness responses, and Kurt Fernhaber will be presenting those. Kurt?
Good evening, City Council. So I'm going to be talking about 4 different items this evening. The first is the change of services and locations of services for people experiencing homelessness that have been made in response to COVID-19. The second is an update on the opening of our COVID Recovery Center that's been open for about 4.5 days now. Third is questions that we received from council members Friend and Swetlick, as well as the community. And finally, some of the steps that we're taking to support the community more generally around human service needs that they would have. Next slide. So the phase 1, that was implemented just over a week ago. And the story that I'm going to tell you tonight started about 10 or 11 days ago. And at that point, it was a meeting that was convened between ourselves, City of Longmont, Boulder County, Health and Human Services, and Public Health. And through the input of our various service providers and Public Health, later that day, we came up with a strategy with the 2 phases that you'll see here that we've implemented. And the strategy was really meant to create a safe place for individuals experiencing homelessness to sleep and to heal, and really to protect them. The homeless population, by definition, can be more at risk because they're outside more, or because their health in particular is more compromised than those who are living in homes. So we saw the homeless in our community as an aspect that really was most highly at risk to COVID-19. So we've taken pretty straightforward steps, and that's what we'll explain to you now. So in phase 1, we moved path to home navigation, which was at 30th Street, to the North Boulder shelter. You're aware that that was going to be happening in June. There was a lot of capacity at the North Boulder shelter, so that seemed to make a lot of sense. Then with consultation with the Department of Health and the concern around how close people are sleeping, beds were separated further apart at 30th Street, and we were only able to do that by moving the services around. Both facilities at 30th Street and the Boulder Shelter for the Homeless improved their cleaning, putting masks on individuals that were symptomatic, and implementing their isolation protocols. And the last thing here is coordinated entry. That's the program where all homeless enter our system. We began giving an option to do that through the phone. So that was implemented on March 16th. Our plan was put together on that previous Friday. I must say the two organizations, the two shelters, as well as the shelter in Longmont, have been very helpful and have really had to move very quickly in order to implement this. They were notified of this change on Saturday, and they implemented it on Monday. Next slide. So phase two, we were actually hoping to implement this last Wednesday. It took us a couple days longer. It was implemented on Friday afternoon. We also were struggling to get personal protective equipment in place. A couple days beforehand, Public Health was able to source that, which allowed us to open on Friday afternoon. So the COVID Recovery Center it falls under the Emergency Operations Center, which is a community function that covers and supports the response to such emergencies like this or floods. The work that we've been doing has been falling under their umbrella. So we've opened the CRC at the East Boulder Community Center or Rec Center. We currently have in our first phase 47 beds with the ability to expand to another 20 beds beyond that. And if need be, we would then go into the gymnasium if we had to expand beyond that. I'll go into staffing later, but it's been primarily staffed at the beginning by City of Boulder staff. We've now included City of Longmont staff, Boulder County, and community volunteers. As soon as it was announced in the paper, they also started signing up to volunteer and began over the weekend. This is a place, it's a respite for care. We do not do medical treatment there. And it's supported by the Medical Reserve Corps, who does rounds once a day at the center. And it's also supported by protocols and sort of the setup of the operations by Public Health. We've put good effort into operationalizing this in such a way where the individuals that stay there have a section for them. Each person has a bed, a desk, a chair, and an area that is theirs to hold their belongings. They're separated from each other. And in the first phase, we have 5 rooms with roughly 10 beds per room. And then there's a staff section where the staff work. And in between is sort of a buffer zone where they don't come into our section, we don't come into their section. And the interaction really happens in that buffer zone for the protection of staff. that are working there. That was implemented on March 20th. Next slide. So the COVID Recovery Center, this says currently there's 6 people there. We had another person come in this afternoon, so there's 7. The first evening, we didn't do screening at the shelters. We had a person that was referred from Clinica. On the second night, we had screening at the Severe Weather Shelter on 30th, and then we expanded to the North Boulder Shelter. And last night was our first night to be screening at the shelter in Longmont. So we've set up a tent in front of each of the 4 shelters where the screening goes on before individuals enter the shelter. They are screened for temperature and symptoms to COVID, and if they are symptomatic, they are given a mask, and we have a van or a 15-seater van at each of the locations. And we drive those individuals to the CRC. The CRC is not a walk-up center for individuals. We keep the doors primarily locked during the day and during the night, so it's really not open to the public. The goal is to keep shelters functioning and healthy, and our concern is that the virus could go throughout one of these shelters, and this is really to help prevent that. We've also received calls from Clinica as well as Boulder Community Health for homeless individuals that are receiving treatment there to be transferred to the CRC. Next slide. So this is a graph that we looked at when we were making our plan about 10 days ago. So on the left, you'll see what the capacity looked like before we implemented phase 1. So at the Boulder Shelter, we were averaging about 120 individuals who were staying there. So we had a capacity of about 40 individuals. Path to Home, we had an average of about 15 individuals staying at the Path to Home side, and Severe Weather Shelter was full. However, many or most of these nights recently, Severe Weather Shelter has been much higher than 72, and those individuals had been staying in those 35 beds. And there were some nights that were over capacity as well prior to phase 1, which I'll cover later. So on the right side of the slide, you'll see sort of the reorganization and how we anticipated that. So moving navigation, those 15 clients over to the North Boulder Shelter brings it up to 135. Maintaining the 72 beds at 30th Street gave us a 25-bed buffer with the anticipation that Severe Weather Shelter clients would be going to the North Boulder Shelter. Next slide. So standing up the COVID Recovery Center, it's been a big lift. City staff has put in a tremendous amount of work into that. So when the CRC opened Friday afternoon up till Monday evening, those 3.5 days, so 321 volunteer hours of staff and community members, 157 from the community, 164 from staff volunteers. And you'll see all the various shifts. We have 3 shifts per day. The first shift starts at midnight and goes till 8 in the morning. Then from 8 in the morning to 4 in the afternoon, and then 4 until back till midnight. And you'll see that we've, with the publicity we've gotten around this, we've gotten a really strong and positive response from the community. 87% of the shifts are currently filled over this week. And it's worth noting, first of all, every shift now has a sort of a shift lead. Each one of those shift leads is currently under the leadership of a City of Boulder employee. However, we're working with Boulder County, who is hiring some staff members, particularly for this the CRC function. So I just want to represent the City of Boulder for a minute. These are the various departments that are representing the work that's going on here. So we have staff that are leaders in this work from Public Works, Parks and Rec, Municipal Court, Housing and Human Services, the City Manager's Office, Open Space, Mountain Parks, and the Library. And from Longmont, we've had volunteers from the Departments of Aquatics, Recreation, Community and Neighborhood Resources, and one City Council member from Longmont. Next slide. So now I'm going to shift a little bit and get into some of the questions that we've received. So some of the questions were about the capacity of severe weather shelter. So if we look at January and February over 2019, we averaged 69 individuals during that time period. And if you remember, we have 72 beds in that location. This year, from January to through February, we've averaged 94 individuals. So you can see that we've begun to consistently go over capacity for severe weather shelter. If you remember from the last presentation we did to City Council, we highlighted the fact that 2.5 years ago when we started this Housing First strategy, 30% of the individuals who were entering our system were from out of Boulder County or had been in Boulder County for less than 6 months. Now, over 70% of the individuals who are entering our system have been here for less than 6 months. So some of that shift is explained in these increased numbers. Prior to phase one, we had overflow beds. There was we worked between the North Boulder shelter and severe weather shelter to try to move that capacity around. Most nights it worked, some nights it didn't, but we often exceeded the capacity at 30th Street, certainly for the severe weather shelter side, and on most nights for both navigation and severe weather shelter. After phase one was implemented, again, we were hoping to have our CRC open on Wednesday, but instead we got snow. And so we had 12 to 19 people that were over capacity that we didn't have a bed for those 2 nights. One of the benefits that's come out of the CRC is that the same 15-seater vans that we've been using to carry individuals from the screening locations back to the CRC, we're bringing them back each night to 30th Street to pick up individuals who didn't receive a bed at 30th Street, and we're transporting them to the North Boulder shelter to make that process a lot smoother. And that's happened each of the nights since the CRC opened. Next slide. So the day shelter was another topic. Public health, in their opinion, particularly in warmer weather, individuals are safer outside versus congregating in rooms. There's public health generally has a concern in severe weather shelter around the congregate living, and that was the reason for our spreading the beds apart. There's also a staff capacity challenge at both of our shelters. And so in this new approach in phase one, both shelters actually open on nights that are triggered by the weather triggers, are open during the day. However, they still struggle to have the staff, and on one day They didn't have the staff to open one of the locations because of the capacity constraints that they have. There's also a need for both facilities to close for a period of time for thorough cleaning that happens on a daily basis. Next slide. So rental assistance, that's another question that the community has been asking about. So we've been working through EFA for rental assistance. That's an infrastructure that's already in place in our community. It works well, and many of the people in our community understand it and know of this organization. We have been supporting EFA further to support additional families and individuals that are challenged with making their rent. And I'll talk on the next slide about how we're funding that. But the state also released $3 million to public housing authorities. So the BHP and the Longmont Housing Authority and the Boulder County Housing Authority are all working together in a single application to receive funds to assist with that as well. We're also working with the owners of affordable housing units in the city to understand what their financial positions are for various properties and what the risk looks like at this point with their residents. BHP did a survey and found out of their 1,400 units, they surveyed all of them. At this point, there was 40 individuals or 40 households that are challenged with this next month's rent. 20 of them are on vouchers, and so the housing or the BHP is able to work with those voucher holders for a lower rent, which really leaves 20 households at risk who would have to go to EFA for support. And I think most of you are probably up to date on evictions and foreclosures. Those are on hold until May 31st. And there's been a moratorium for single-family homeowners through the for FHA insured mortgages, and through the state, there's been measures provided as well. Next slide. So this slide is to really talk about the coordination that's been going on. So there's a community or a funding collaborative that's an existing organizational structure, which includes City of Boulder, Longmont, Boulder County, and our community foundations. They have been meeting on a daily basis and coordinating all funding to all agencies to ensure that agencies are being funded according to the needs that are in the community. And each of us are understanding and sharing how we're funding the various organizations. There's also coordination through the nonprofit organizations as well, and they all meet twice per week, and that gives us an idea of what the needs are within the community. And a lot of this funding and decisions is made in a timely manner, and we're really using some of the overall community needs to drive those decisions. So $870,000 has already been released within the county since over this last week, and we'll be monitoring these additional funds that we can bring in to understand where to best support, whether it's food or rental assistance or other areas identified by the community organizations. Next slide. Another one of the questions that we've been receiving on a daily basis is the location of the restrooms in the community. And this I'm not sure how well you can see this slide. The print's a little bit small, but we currently have 8 restrooms that are open, that have running water and hand washing facilities. You'll notice that we have 2 around Chautauqua. We have 3 kind of in the downtown area, Central Park and Pearl Street. We've got 2 up in the north, and then east of Foothills on Valmont. You'll notice those are the ones in blue, and then the ones in orange, which there's several more, are more closely associated with where some of our parks are. And some of them have sanitizer, most of them don't. But in this public forum, I would plead with the community to not take the hand sanitizer from these facilities, because I know the Parks and Rec staff are having a difficult time keeping soap and sanitizer in these facilities. Next slide. Oh, that's actually my last slide. You can go back. Thank you. So any questions that you may have?
Yeah, I've got 3 on the queue. I've got Mary, Adam, and Junie. So Mary, you want to start?
Thank you for that, Kurt. Really appreciate all the enormous amount of work that you and staff and volunteers have done. This is really an amazing accomplishment. So thank you for that. My first question has to do with all of these resources that you mentioned for rental assistance, financial assistance. Is that all on the COVID website, city website?
So are you talking about the organizations or the funding?
The funding, well, both, because there's a family resources page, and is that all on both the resources and the organizations where people can go? Is that all in that location?
It is. However, I would put out there that Boulder County is really the organization that holds the overall umbrella for services within our community. So I would urge people of particular needs to also visit the Boulder County website. As far as funding, it's actually not on there because it's a moving target. We have, within Housing and Human Services, identified what funds and what resources we have more immediately, particularly funds that were carried over from last year in the Health Equity Fund and the Human Services Fund. And each community is looking to identify their funds, but we're also, sourcing funds from CDBG. I think we've got about 300,000 that we're getting from them, and the state funds that have just become available. So we're also, that funding collaborative is also tracking both the legislative and funding mechanisms that are occurring almost on a daily basis and tracking those.
Thank you. So that's kind of the behind the scenes money.
Yes.
What I'm interested in knowing is, when people ask us about rental assistance, where is the best place to send them? Is that the county website?
If they need rental assistance, I would send them to EFA.
Okay. Thank you. I have more questions. Going back to the COVID Recovery Center, the CRC, that is just amazing what you've done. So my first question is, if a council member wanted to come by and visit and have a look, is that possible?
I think that's fine as long as you sort of set it up in advance.
And would that be with you?
It would be with me, yes.
Okay, great, thank you. And then you presented some numbers there that were kind of disconcerting, and that was the increase in severe weather shelter between last year and this year. And what do we attribute that?
So I think what we've seen and what we've heard from the various providers, one of the things we heard from Bridge House when Severe Weather Shelter went to opening every night, most of the individuals, or a large number of the individuals that were in navigation, dropped out of navigation because they didn't need it anymore, because they in their mind, Severe Weather Shelter was always there. Previously, Severe Weather Shelter was only there on cold nights. So it sort of shifted the population from navigation to Severe Weather Shelter. Some of those, I know Bridge House worked diligently to try to recruit some of those individuals back, but it from a number standpoint, it basically dropped in half over what it had been. It had been averaging 38 individuals, and I think it went down to an average of about 20, and it was at 15 at the time that we made the changes just over a week ago. I think that we've also heard, and I mentioned this last time to City Council, other communities have seen Boulder and our capacity, and it certainly has attracted individuals. And as the numbers or the percentages that I showed you, the people who are using our services, particularly in Severe Weather Shelter, are more predominantly from out of town.
Thank you. And then with respect to volunteers, again, if people wish to volunteer for helping out with the 3 shifts or 50+ shifts that you have at the CRC right now, would they call you, or who would they call?
Please don't call me. Yeah, they would. So both the newspaper article and the and if you go to the COVID website, has the link that you go to for that. But if you go to the COVID website, and also the City Boulder communications that have gone out also have that link. But if you can't find it, just go to the COVID website and you'll find it there.
Okay, thank you. And then I have my final question has to do with you. So you mentioned that BCHE, the Boulder County Housing Authority, Boulder Housing Partners, and the Longmont Housing Authority are all working together to make sure that people who are needing some sort of assistance with housing are receiving it. I'm wondering about people who are not within housing that is provided by those agencies, people that are in the market rate affordable units, as well as HUD-run buildings such as San Juan del Centro.
Yes, those in particular would be great candidates for EFA. And we have increased our funding to EFA. There was resources that we were going to give them later in the year. We've advanced those funds earlier. And then also some of the CDBG funds are able to assist individuals with rent assistance for up to 3 months.
All right. I believe those are all my questions. Thank you very much.
So I want to, Chris, you want to say the answer that you just gave by text to Mary's question?
Sure. If people would like to volunteer to sign up, as Kurt mentioned, the link is on the city's COVID website, but it's also, the direct link is countmein.bouldercolorado.gov. So countmein.bouldercolorado.gov.
Thank you, Chris. Thank you, Mary. Adam, I've got you next, and then Junie, and then Rachel.
Thank you, Sam. And Kurt, thank you for all the work that you've been doing. I know it's trying to balance a whole lot of things all at once, and I really appreciate it. First, I just want a little clarity. Is the standard practice right now, if Severe Weather Shelter is at capacity, we take those people who are over the capacity and van them over to North Boulder Shelter?
That's correct.
Okay, just want to be sure of that.
Yep.
So if we're at capacity at Severe Weather Shelter, have there been nights that we've also hit capacity at North Boulder Shelter recently?
I don't think that I am not aware that we've hit capacity. Every night that I've communicated with them, which is almost every day, it's typically 3 to 5 beds. I think there was one night where they had hit capacity, but they still had 1 or 2 beds that were vacant, but they were beds for females, and the individuals were male, and so they essentially hit capacity. I know there was one night where that occurred, and I think there was one individual, if I recall, that did not find a bed that night.
Okay. And when we're looking forward, is the assumption as the weather warms up that there will be fewer capacity issues?
Yeah, that's generally how the trend goes each season. That would be correct. Yeah.
Okay, and depending upon how long the crisis sort of, remains, would you expect that we're going to have a lot more people who are in need of sheltering services because of their financial situation?
So there's a lot of things that we don't understand how they're going to roll out. So currently, as I mentioned, we have 7 individuals at the CRC. That could expand to a number which is much larger than that. And because it is focused on individuals who are experiencing homelessness, I would expect that the numbers would actually go down at any of the 4 shelters as a result of that.
Okay. I had one more question for Kurt specifically regarding the bathrooms. When I look at this map, I notice there's sort of a glaring hole when it comes to where the 30th Street shelter is located. Is there any capability to put a mobile hand washing station there? I know we've discussed it a little bit, but I wanted to see if there was any more talk of doing that.
I would have to have someone get back with you on that, because that would be, at least if it's in a park, it would have to be on city property.
Okay.
And so my assumption is that would be something that Parks and Rec would possibly respond to, but I don't really have information on that.
If 30th Street Shelter gave us permission, do you think we might be able to do that?
We could look into that, sure.
Okay, thank you. And the last question I have is for Jane and Kurt, sort of combined. Is it possible that we can be informed when Severe Weather Shelter hits capacity in our daily updates?
So at this point, I can't promise that. And the reason is each of the providers, well, first of all, they normally give us the information on a monthly basis. We were asking for this information a few days ago. We got some of it just as actually during this presentation. We received some of our first information for March. I know that they're also having capacity problems, and I mean, that request is out to them.
Okay.
And I think we can provide it when we receive it, but I can't speak for the organization's ability to do it on a daily basis.
Okay.
But any information we receive, we can obviously pass on to you.
Yeah, I would be super appreciative of getting the information as soon as you have it.
Yep.
Okay, thank you. That's it, Sam.
Okay, great. So I've got some colloquies here. I've got a follow-up from Aaron and a follow-up from Rachel on responses to Adam's question. And then after the colloquies, we've got Junie and Rachel. So Aaron, why don't we start with you?
Yeah, just following up on Adam's question about sanitation facilities over on 30th Street. My memory from a previous update from Jane was that we had some coming online on April 1st, like 2 or 3, and one of them I thought was at the Mapleton Ball Fields. Do I remember that correctly?
So that's what I recall from the information that was sent out that we received from Parks and Rec. So that facility can only be open once it it reaches a certain temperature, but that is in April. That's correct.
Yeah, so I think in a week we will fill that hole there in terms of sanitation in that part of town when that non-winterized facility opens up.
Okay, great. Is that everything, Aaron? So Rachel, follow up to Adam's questions.
Yeah. Hi, everybody. Thanks, Kurt, so much for all this information. Just really quickly, on the hand washing and hand sanitizer stations, we've had a lot of public requests for a lot more of those. And so I just thought maybe you could explain why we aren't doing that more broadly around the city. I don't know if it's because it has to be city property, if it's concerns about people stealing the sanitizer or hand washing things, or if it's just something we're still looking at. That's the question. Thanks.
Yeah, I'm not sure that I'm the right person to answer that. What I do know is that there's a lot of frustration that the facilities that they currently have, that the sanitizer is taken usually within 30 minutes.
So let me jump in for a minute, if you don't mind. Excuse me. The other thing that I've heard from our park staff is that getting hand sanitizer dispensers, they're back ordered by quite a long way because of the current crisis. So I believe that we have some on back order, we just haven't received them yet. That is my understanding.
I appreciate that. Thanks so much.
Great. And then we've got Junie and then Rachel again. So Junie, you're up.
Hi, Kurt.
Hi, Junie.
I just have a quick question for you, and thank you for all the work that you're doing. You're doing amazing work. I just have a question about complaint mechanism, and we've talked about that before. And I know you mentioned to me through our mediation processes, we do have a complaint mechanism, but with everything that is going on with this emergency, I wanted to hear more from you and what can we do? And I'm wondering if we can have a link that is readily available for people to complain, because I've received quite a few phone calls from community members who are currently being pressured into vacating their current property. So they're basically facing eviction, although you just mentioned an eviction moratorium. So although most landlords are really nice people, some of them are under a lot of pressure as well. So I want to make sure that we protect the people in this community. So what can we do to ensure that people have access and know who they can complain to so that they can remain in their property?
So there's two things. So our mediation team is still working. However, they're working telephonically, which may not be quite as effective. But on our website, you can go to mediation as well. Mediation, the folks working in mediation can help sort of navigate those situations. And again, if they're having difficulty actually making the payment of rent, then that's where they would also be going to EFA.
But is it possible to have a link to our COVID website so that people can have access to it? And also my next ask would be also a link for people to either for our services through VHP. So my point is not just the fact that we have available services, but in this present moment, we want people to know right away who to contact, because I've had people contacted me, and I think how they know, had it been available to them, they could just find it themselves. It would be much easier.
Yeah, so there's a frequently asked questions document on the COVID website where it talks, where navigation is covered there. But I would also be glad after this call to send you that information directly so you can give that to any individuals as well.
Yeah, thank you so much. But I'm hoping that we'll be able to put that on the website so that tenants can have access to it rather than me having to provide that to them.
Yes.
I have one last question for you. And it has to do with the IF Boulder Center and for the volunteers that we've been, I wanted to know if you're well staffed and why are the shifts so long? Because I want to volunteer as well, and I've seen that some of the shifts are very long, and I can imagine some people who want to volunteer may not come for that long period. So is there still opportunity for people who want to do just 2 hours instead of the 4 or 8 hour time?
Okay, good question. So some of the one position that's the shortest position is the screening position, which actually happens at the shelters. And that's about a three hour volunteer position. The rest of the positions at the CRC are all 8 hours. One of the reasons for that is we have to go through much further training before someone volunteers there. You know, it takes about 20-25 minutes to train people. But the biggest reason is because PPE is in such high demand, we can't have a number of shifts and go through more PPE. So that would have a significant impact on that important resource.
Thank you.
Okay, and Rachel, you're the last one I've got on the queue at the moment.
All right. Follow up on that EFA emergency financial support for individuals. I was a little bit confused because I thought that was going through coordinated entry for individuals rather than families. So did that switch over to EFA now?
So it goes for individuals who are experiencing homelessness or who have just become homeless, they would go through coordinated entry. For others, they would go directly to EFA.
So for people who are not yet unhoused, but they're individuals, not families, they can still go through EFA.
That's correct, yes.
Okay, thank you.
Yeah.
Just one more question on this, and then one more that I'm not sure is for you or for later. You had said at the front end of this conversation that you were concerned about unhoused people being more at risk for COVID-19. Are we seeing that yet in the numbers?
Luckily, I don't think we are yet. We have, out of the 7 individuals that are there now, there's probably a couple that they seem very likely to have COVID. One of the things that I'm concerned about is we've had 3 individuals, one of who tested positive for COVID, which we were going to pick up, and they sort of disappeared.
Oh.
And so, I mean, the other thing that we need to do is, well, first of all, I think we put a lot of effort into creating an environment where the people who are staying there can be very comfortable for 10 to 14 days. So we've had community members drop off books and games, and we got DVDs going, and, you know, just things to keep, you know, they're not used to being inside 24/7 for 10 to 14 days. I think there's a little bit of fear for some individuals in our homeless community about, you know, being taken by the government to some location. And we're really trying to create a communication strategy that identifies what a welcoming place this is. So that's a real challenge that we have. While the numbers have been low, I'm not sure that they're necessarily representative of what's actually going on.
Okay, thanks for that. That sounds representative of what we're seeing nationwide with the numbers, right?
Yep.
And then my last question, I think it's yours, but it's not on homelessness. Should I ask it now? I had brought up last week concern about partners and children who might be sheltering in place in abusive and unsafe homes. So I was wondering if we had more information on that.
Let me check with Boulder County on that, because they would be the ones that would deal directly with that, and I can get you more information on that.
Okay. Thank you.
Okay, Kurt, this is Sam. Thank you very much for your hard work. I mean, I've been talking with you on and off as you've been putting all this together, and it is unbelievable what you've managed to pull off in a really short period of time. So thank you for that. I think we have lots of conversations that we need to get back to, but not right now. Maybe during the summer as we look to the next sheltering season. Is that all that you had for us?
It is, yes.
Let me see, I just got a text, I may have a question. Okay, so Mary asks if she could ask general questions, and then Mirabai wants to ask about assistance for small businesses. So Mary, is it a question on housing and homelessness? Is it a question you think we might get to in Carl or Yvette's presentation?
It's a question for Kurt.
Okay, super.
Yeah. You mentioned in your responses to our many questions, you said that's a question for Boulder County, that's a question for, Boulder Human Services. How can we make better decisions, we council members make better decisions about where to direct our questions so that we're not asking the wrong entity? Or can you provide some advice on that, please?
Sure. So I think, so Boulder County, it's really under their umbrella to address social services generally. We obviously work in close collaboration with them, but many of the programs actually fall under the sort of the responsibility of Boulder County, of those types of services. And the city really focuses on targeted areas that are specific to our community. And that's why we work so closely together with them, so we're aligned in the areas. And quite frankly, a lot of the things that we support are priorities of city council. For example, the after-school program that we do in five of our elementary schools, that supports families and children, low-income families, and immigrant families in those schools. That's a city council priority, but by and large, the social services fall under Boulder County.
So is that link something that we should have handy and direct people to directly instead of going to the city's COVID site?
Absolutely. Yeah.
And if we could just get that in, that'd be really helpful.
We'll do that.
So this is Sam. I'll check in with Mirabai first, and then I have a comment. Mirabai, did you want to ask a question related to housing?
No, mine's going to be related to businesses, and I just don't know where that's going to fall into this discussion.
Yes, it will be under Yvette's presentation. Jane, is that right?
Yes. The next presentation is Carl and then Yvette, and it will fall under Yvette's area.
Okay, perfect. I'll hold off till then.
Thanks.
Okay, super. And I guess one of the points I would just raise for other council members to think about is it's kind of, we have to be a little careful, I think, about overloading our website, because we do want all the information available there, but we certainly want the most important information available at the top. And so as we come up with ideas for how to direct people, I think Mary's question is really germane, which is, if certain sections of information are Boulder County, then I think we should, make sure that we say this list is best served by Boulder County, rather than trying to duplicate their information. I just fear overwhelming people. They open the website and they see, how long it is, and they're like, oh, this is too much to pick through. Anyhow, I would just offer that thought is it's a complicated balancing act, but it feels like a lot of things we're doing right now are complicated balancing acts. So, okay. So, any other questions for Kurt? Okay, Jane?
Thanks. So, Chris, could you put up the next slide? Okay. Yeah, so we have put together a bunch of information on the state and federal response to the COVID situation, as well as the city response. And so we actually are, I think, asking Carl to go first to talk about the research that he's done with regard to the state and federal availability of funds and programs. And then Yvette will follow up with her work with our community partners in the city and the work that we've done there. So Carl, it's yours.
Okay, thank you, Jane. Can you hear me okay?
Yes.
Okay, great. Good evening, Council. My comments tonight will focus on the state and federal response to the economic impacts of the COVID crisis, specifically the economic impacts to both individuals and business owners. So it does not focus on efforts to combat the virus itself. So starting off with the federal action that has occurred, I'm going to focus on legislation, specifically 3 appropriation bills, 2 that are now law, and 1 that is soon to be expected to be enacted. And I will touch on the aspects that are most likely to provide direct help to Boulder's community. So first of all, on March 6th, there was an appropriation of $8.3 billion through what was called the Coronavirus Preparedness and Response Act. That bill was mostly health focused, but it did classify coronavirus as a disaster, which allowed the disaster loans program account to be used for economic injury loans as a response. It also included providing $20 million for the Small Business Administration, mostly for administrative costs, including salaries and related expenses. The second more significant bill was passed on March 18th. That appropriated over $100 billion through what was called the Families First Coronavirus Response Act. That had more significant benefits. It provided for $500 million for the Special Nutrition Program for Women, Infants, and Children program, also known as WICS, $400 million for the Emergency Food Assistance Program, $1 billion for states for processing payments of unemployment insurance benefits, flexibility for the continuation and distribution of meals under the National School Lunch Program. It did direct employers with fewer than 500 employees to give 12 weeks of job-protected, unpaid family and medical leave for individuals who are in self-quarantine, caring for an at-risk family member, or if their child's school had been closed due to the coronavirus. It also expanded the emergency paid sick leave program, directing employers with fewer than 500 employees to provide 2 weeks of paid sick leave at the regular pay for self-quarantine, or 2/3 to care for an at-risk family member, or if their child's school had been closed due to the coronavirus. So that brings us to the massive stimulus package that's currently being considered. I just checked online. It looks like there is reason to believe that it actually might be voted on and approved tonight. Certainly encouraging. It is approximately $2 trillion that is being considered at this point. Let me give you some of the highlights. Focusing first on the Small Business Association. It would include $349 billion for loan guarantees and subsidies as part of the Paycheck Protection Program, which helps small businesses pay employee salaries, pay sick, medical leave, insurance premium, mortgage payments, and other debt obligations capped at $10 million per loan. It would provide $10 billion for emergency economic injury disaster loan grants for startups, co-ops, and employee stock ownership plans with less than 500 employees or individuals operating as sole proprietors or independent contractors. As far as unemployment assistance, it would establish a pandemic unemployment assistance program through the end of 2020 to provide benefits for individuals not traditionally eligible for unemployment benefits, including those who are self-employed, independent contractors, and others who can no longer work due to the coronavirus. It would ensure that individuals receiving unemployment benefits will see an emergency increase of $600 per week for 4 months. It would ensure that individuals who remain unemployed weeks after a state unemployment benefits are no longer available would be given 13 weeks of additional benefits. It also provides for individual rebates. You probably have heard about these. Specifically, it would provide $1,200 checks for each individual with adjusted gross income up to $75,000 if you're single, or $112,000 if you're the head of the household, and $2,400 checks for married couples filing jointly with an AGI of up to $150,000 based on 2018 or 2019 tax returns. It also provides $500 an increase in that amount per child of $500. Finally, it does provide for a 10% a waiver of the early withdrawal penalty, which is currently in place if you take money out from your retirement. If you're taking money out for coronavirus-related withdrawals up to $100,000, and it's made if it's made anytime this year, it would waive that penalty. It would provide relief to businesses, including allowing employers to defer paying their share of a Social Security tax. It would also provide $15 billion for SNAP in anticipation of increases in program participation due to the coronavirus. It would provide $750 million for the community service block grant that Kurt was talking about. That would go straight to community organizations to aid those most vulnerable in the community. It would provide $250 million for low-income home energy assistance program, $4 billion for homeless assistance grants for local governments to combat the coronavirus among homeless populations, and $1.25 billion for Section 8 housing choice voucher programs to help with rental assistance for low-income households, seniors, and individuals with disabilities. So that is likely to pass this week. I think we can pretty much expect that to occur, and perhaps as early as tonight. There is also very serious discussions already underway about future stimulus packages. So want council and the public to know that Boulder has been and will continue to reach out to its congressional delegation, urging support for whatever programs and possibilities exist to aid our community. We've spoken directly to our members, we've sent a letter, and we will continue to do that. I will now shift to state actions. This is a little bit shorter and it's not riddled with numbers, so perhaps a little bit easier to follow. Governor Polis has taken several steps in terms of sending messages, very strong messages to our community in Colorado. He has encouraged banks, credit unions, and other financial institutions holding residential or commercial mortgages to halt foreclosures and related evictions. He has discouraged public utilities from disconnecting service for delayed or missed payments from residential and small business consumers. He's asked property owners and landlords to refrain from removing tenants or mobile homeowners without cause or as a result of late rate rent payment or minor tenancy violations. And he has directed the appropriate department to expedite unemployment claim payments. And finally, the state has followed the federal government's lead in extending the income tax payment deadline for all Colorado taxpayers by 90 days until July 15th. So that is the end of my comments. Are there any questions that I can answer for you?
Thank you, Carl. I don't have anyone on the stack at the moment. So now I've got Aaron. Aaron, go ahead.
Yeah, Carl, thanks very much for that update. So I understand the stimulus bill at the federal level is still getting finalized, but in that list of things that you mentioned, would there be some that are local small businesses would be able to tap to get through? Can you kind of address specifically what might be useful for local small businesses that are in tough shape right now.
Right. Okay. Thank you, Councilmember Brockett. Specifically, from a small business perspective, I would draw attention to the $349 billion for loan guarantees and subsidies that are being appropriated. I will actually probably defer to Yvette Bowden to explain more about how that might happen and how that might trickle down. I'm not completely familiar with that. And then there is the $10 billion for emergency economic injury disaster loans, which would be going to startups, co-ops, and employee stock ownership plans. I unfortunately am not very familiar with these programs, nor how they get directed, so I'm hoping that this information can complement the presentation you'll be receiving from Yvette.
Great. I'll ask her about that. And then the other one, how about specifically out of that, do we have a sense of whether folks who are struggling to pay their rent might be able to get kind of direct assistance with that from part of that package?
Right. I think that can occur first and foremost with the individual rate rebates that will be issued, although of course that's a limited amount of resources.
And you don't have to have the answer right now, but maybe that we could get some follow-up in the next day or two once this does get finalized about those kind of specific areas.
Okay, I will make notes of that and we'll follow up.
Thanks so much.
Of course.
Great. Now I have on the stack Mary, Mark, and then Mirabai. I think your question maybe applies here and or add that. So Mary, why don't you start?
All right. Thanks, Carl. I have a question regarding what does the lag look like between the federal money that's been appropriated? What's the lag time between that and when it reaches the local level? And where does it go?
Yeah, that's a good question. And I don't have an answer for that either. I am making notes. I want to make sure that when I provide, as you know, you're getting daily updates now from Jane, and I want to make sure that I include a response to that. It'll be a question about whether these are going directly to the state and then suballocated to the local governments, and I don't have an answer for that, but I will look for that and provide you an answer.
Thank you. And so then the kind of a follow-up question to that, when the funds hit wherever they're supposed to be accessible to people, where would people go to who need mortgage assistance?
Okay, I am again making notes on that.
And then my final question about the federal dollars is, I understand that Comcast, for one, has provided free internet access for the next 2 months for kids that are home from school. But there's also, I believe, in the bill in question that hopefully will pass tonight, an element that consists of providing telehealth, because that, of course, keeps people out of the hospitals, et cetera, and opens up the healthcare system for COVID. Obviously, for telehealth, you need internet access. So is there any assistance for people who could use telehealth but don't have internet access, and how will there be any dollars for that?
Okay, I made notes and we'll follow up on that as well.
Okay, thank you. So then I have, my final question has to do with the statements that Governor Polis has made. In the first 3 bullet points on that slide, it used words like encourage, discourage, refrain.
Right.
Is there any legislative or structural energy behind those, or is it just hoping that people do the right thing?
I think at this point, I think the governor is really sending messages. And and strong messages at that. In terms of legislation, as you know, the General Assembly is recessed and they are considering whether they can reconvene and vote remotely. Bless you. And so we'll see if they can add some teeth to what the governor is currently just sending a message on. I don't quite know to what extent the governor and the state of Colorado has the ability to make these what are currently just messages into absolute mandatory requirements. So that is a question that needs to be answered as well.
Okay. Thank you very much.
You're welcome.
Thank you, Mary. Then we have Mark.
Carl, thank you. Thank you for that presentation. I want to follow up on Mary's question. Have we seen any result yet from these exhortations to lenders in the financial sector to forbear on foreclosures and evictions and the like?
And I'm sorry, I did not quite get this. Are you asking if we've seen any action in terms of people, whether they're willing to heed the direction that the governor?
Have any of our major institutions actually responded?
Yeah, that's a good question. I will make a note of that and I will get back to you.
Thank you.
Anything else, Mark?
No, that's it.
Everybody, do you want to ask a question of Carl or hold it for Yvette's presentation?
So my question is what Aaron asked already, and I was holding it for Yvette.
Okay. Carl, I think that's a wrap here. I don't see any more requests for follow-up questions. Thank you for the update. We'll look forward to, hearing from the daily update what's going to happen with our federal government. I mean, I think that's kind of the real unanswered question at the moment is what are the feds going to do to help the state and the cities out? Any updates you have, where do you get them?
Thank you.
So the next person up is Yvette. Are you ready, Yvette?
I am. Good evening, Council.
Thank you.
So to give you a picture, I know you're all well aware, and I want to thank my colleagues for all of their work and also our partners. I'm going to give a little overview on the state of our businesses. Boulder is home to 7,000 businesses, and most of them are small. About 3/4 of our businesses employ 10 or less employees. Small businesses in Boulder provide approximately half of the jobs in the city and about 40% of wages in Boulder. So in large part, less than 1% of Boulder businesses are in fact large, with over 250 employees. And I also wanted to point out that retail businesses, as a component of that, generate sales and use tax, which are very important to the city and contribute about 50% of general fund revenues when you exclude utilities. You can go to the next slide. On March 12th, our partner, Boulder Chamber of Commerce, issued a very quick survey to just see what the anecdotal response was in the most immediate needs and pressures facing local businesses. Very quickly, there were 308 responses. We've got more since then. And with a group of partners that I'll explain in a second, there was high expression of priority needs. First, which we're all speaking to, resources for operating expenses. Businesses are concerned about paying their commercial leases, paying their employees, getting their equipment and the like. Second, the businesses are expressing a need and desire to continue to assist their impacted employees. Many are making very, very difficult decisions right now, and the employees are impacted. So they're looking for ways and easy ways to navigate and share with employees information. And the city has already been helping with a lot of that, but I'll put a pin in that in a second. Third was information on safe operations. There's an outcry from Boulder businesses that as they are operating, they want to do so safely and in compliance with the guidance that has been put forth so far. There has been a request for consideration of expense mitigation, help with discussing their rental obligations, and consideration of taxes and fees. And even more importantly, and a real sign of the commitment of Boulder's businesses across all industries, they want to plan for the future and they want to be part of the creation for that plan. We know that these are challenging times, but we're also looking toward the future. Next slide. On the right of this slide, I want to acknowledge the important cooperation that we have been experiencing as a city with all of our economic vitality partners in monitoring and responding to businesses, worker, and community needs, from the state and county to certainly the Small Business Development Center, the Chamber, CVB, Downtown Boulder Partnership, and the Community Foundation. We've established as a coordinated group a set of goals. These largely mirror the city's goals, but go further than the health emergency, of course. We want to support the direction and guidance that prioritizes public health and safety, adapt local practices to provide for essential services, anticipate and respond to the needs of impacted residents, businesses, and their staff, and appreciate the current state of the impact as well as plan for long-term economic resilience. In the Community Vitality Department of the city, this is work we do all the time, but it's never been more important than now. Next slide. So what have we done to date? Carl mentioned and Kurt mentioned in his presentation as well some of the resources that we are constantly looking for. The Small Business Association loan application is on the city's website and on all of our partners' website, as well as looking for and exploring state and locally available grants and resources. The city has a dedicated web page for business resources that we want everybody to be aware of. And it's there, by the way, this bouldercolorado.gov/coronavirus is the city's general website in response, but the second piece there, business resources, are just created for businesses. With the response from those 308 surveys, we've been able to manipulate that site that has been updated this afternoon to bundle those in pieces of information, related news updates, consultation and application assistance links, information on safe operations, free webinars, and links to web pages for those who are posting job opportunities because they have vacancies right now, as well as people who want to post their resume. So there's a job seeker side and a job opportunity side available through our link. We also have been working to coordinate and promote gift card, gift certificate opportunities, purchase opportunities for delivery and pickup, and we help to coordinate the safe shopping provider list that Council mentioned before, and that was in Kurt's presentation. There's already work underway to help people show their love for local businesses, including Downtown's Boulder's Love the Local initiative and what we are trying to put together on a broader citywide scale. We're continuing to explore assistance for small businesses and impacted workers, and of course, ongoing coordination with the governor's office, Congressman Negus's office, and the county. Next slide. So the work continues, and really we're just at the very beginning of it. On April 28th, Council will have a study session where we dig a little deeper with the finance staff of the city to include a sales tax update, again, very early. Ongoing pursuit of advocating for this federal state assistance for impacted businesses and workers, connecting businesses and workers to those assistance programs. And I want to mention that as partners, we are meeting once a week. And so we will all be refreshing our sites, and the city's website will also be refreshed as often as we can. We're soliciting data on the scale of economic impact. I anticipate that very soon the city is going to try and put its arms around a little bit more than the anecdotal information that was so valuably gathered by the chamber, so that we can really look at temporary business closures, experience revenue decline, workforce impacts. We'll be monitoring and aligning with federal, state, and peer cities and their offices of economic development and economic vitality. And I did want to point out, which Kurt sort of alluded to earlier, we're continuing to work with Google and wrapping up the fellowship for Boulder for Me, which is the service eligibility navigator, to hopefully make access to city services easier to find in English and Spanish. That is very quick, but that is a summary of what we're working on right now, and I'm available for questions. I did want to, even before we go into this further, Councilmember Nagel mentioned how can small businesses get access to the application and whether or not there's a lag time. I don't have information right now on what the lag time is. I can tell you that we are actively working with the Small Business Development Center and trying to navigate and help them get the resources they need to assist local businesses and getting through the application process. It's been quite flooded, as you might imagine. The application is available on a direct link from the city's website. And with that, I'll turn it over for questions.
Thank you, Yvette. I'll start with Mirabai. Mirabai, did you have any questions here?
No, thank you, Yvette. This was extremely helpful, and I will make sure. I have a lot of businesses emailing me, so I will make sure to pass this information along. But this is fantastic, so thank you so much for all your hard work. I know this is a really sensitive topic for so many, and a lot of people are scared out there, so you guys have made this quite flawless. So thank you.
Thank you.
So then I've got Mark Wallach and then Mary on the stack. Mark, you want to go ahead?
A very, very quick question for Yvette. The April 28th date is going to be very consequential in terms of what it shows us with respect to sales taxes. Is it either feasible or appropriate to move that date up a little earlier so that we get a sense of what the real impact is and what we need to do about it?
So that would be a question certainly that we could bring to CAC. What I do want to point out that this is a larger, or was going to be a larger conversation about the budget approach in general that I know several council members have been working on. And our central finance group may need a little bit of that time to be able to update the most recent tax receipt information. But I'll pass that request along.
Okay.
And Mark, I'm going to jump in just for a second to say that April 28th is probably the very first council meeting at which we may have data with regard to sales and use taxes, because people remit those on the 20th of the month. And we are going to need extra time to collate that. And so just even the 7 days or 8 days between when we receive the information and the revenue to when we report to you on the 28th is not really enough time, but we're going to do what we can to put it together. So that's one of the issues, and I'm sorry.
Thank you, Jane. You've sold me. Thank you.
Okay, very good. Mary?
Thank you for the presentation, Yvette. One quick question is, today we received a very eloquent email, if I might say, from one of the restaurateurs in town. And one of the things that he brought up was that there are many small restaurant owners that are from different cultures. And they may not have a command of the English language and could easily be caught up in situations that don't favor them. So I'm wondering what kinds of approaches we might take there.
Thank you for that question. As we navigate this response, we want to be sensitive to businesses of all industries, all makeups, all sizes, and certainly of providing the same type of inclusive services that my colleagues in other disciplines desire to provide. So if we need translation services, our department can certainly look into that and help with that assistance. It is something that I'm discussing with the Small Business Development Center and will bring to their attention.
Thank you, Yvette.
Okay, Rachel?
I do not have a question. Mary had texted me that she had a question, so I was letting you know that in case she didn't get through to you.
Okay.
Good. Thanks, Yvette. Great presentation.
Thank you.
And I would just say, I think if we're done with questions here, we want to kind of organize our thoughts on how we're going to talk about economic impacts to businesses, to landlords, to employees, and to residents. So I think, Jane, you and I had spoken before that because the county is going to issue their order, we probably don't need to go through the exceptions to the order or changes that we want to make tonight, but we can do it over the next week or so. Do you want to speak to that a bit?
Yeah, sure. That is something that we discussed, and I mentioned it a little bit earlier. We did receive many emails today, as I'm sure you all did as well, and we responded to many of them, but a number of them we were saving for this evening. After talking with Jeff earlier today on a conference call with many others, I learned about the order that they're passing, and a few of the items that we were asked about will be dealt with in that order. So what we're wanting to do is to tomorrow see their order. I will pass an amended order that incorporates or that completely mirrors the public health order. And then there will be an opportunity for people to have a call line, I think, at Boulder County. We're still working on that. And we also have the Joint Information Center where we will be able to refer all of the questions and start getting things answered. So spending time on it tonight might not be the best unless council members do have particular questions about areas that they were most interested in. And in that regard, then Tom and I would be available to answer those questions.
Thank you. I see Adam here with a question.
Yeah, thank you, Sam. Jane, I did have a question regarding what makes construction workers essential. I don't know if you have a direct answer to that, but if we don't have building inspection going right now, you know, it feels like kind of a weird thing.
Yeah, I get your point. We were mirroring the Denver order, and they had added construction in there. There is construction still going on in the city, and I had a call today with the Planning and Development Services managers, and we are beginning to understand ways in which we can do some few virtual inspections. And we're considering whether or not we would hire third-party inspectors to do some inspections, but we sort of don't want to put them in harm's way, just like we don't want to put our own staff in harm's way. So that is a question that we're beginning to address. So I don't know the answer to that, and I'm going to be anxious to see what the public health order has in mind with regard to construction.
Yeah, my only observation was people are working pretty closely together on construction sites. And if it's not truly essential that they be built quickly, you know, what can we do in that regard? Thank you.
You're welcome.
Okay, great. On the stack, I've got Rachel, Mark, and Aaron. So Rachel, you want to go?
Yep. Thanks, Jane. I just wondered, there was something in the order about limiting public transportation, public transit for just essential business. And I wanted to make sure from an equity perspective that if you don't, say, live near open space and don't have a car, you can still do the same outdoor activities that somebody with a car or close trail access could do.
Yeah, so part of what I view about the order is that there's some common sense that needs to be applied to it. And so I don't think there's going to be people walking down the aisles of the RTD bus system to make sure that you're going one place and not another. So if that's your only way to get to a trailhead, then I think that would be fine to use that.
Great, thanks.
It should also be clear that the order doesn't allow people to drive to trailheads either. So, I mean, I think there's a lot of things that we have to figure out in this, and we'll be working with the county to try to see what's necessary in Boulder.
So but we still can use trailheads. So that would mean only if you live right close or close enough to walk would you be able to use them. So that would be a real big equity concern for me too.
Yeah.
Okay.
We'll all be working this out as the days go on.
Okay. On the stack, I've got Mark, Aaron, Mary, and Junie. So Mark, you're up.
Short question, Jane. Emergency Order 2020-6 permits houses of worship to operate, but there's no requirement for social distancing protocol. I can't think of anything more problematic than a packed congregation.
Yeah, so Jane, I can answer that. I mean, obviously, Mark, you understand the First Amendment implications of the government telling people they can't worship. And if you look at the order closely, it's written in terms of encouraging them to use social distancing, limit the size of the congregation, but I think it stops short of ordering. And so again, that's something we need to work on. And most congregations have limited the size of their services. So we're not really seeing a huge problem with that. But I believe it was a constitutional issue why it's written like that.
Thanks, Tom.
Okay, Aaron.
Thanks for that. So I'll mostly stay away from one issue or another here, but Jane, you did bring up inspections and the possibility of doing some virtual ones and such. One question I had was if an inspection is for a finished unit, like a residential unit that's just needs a last inspection to get a certificate of occupancy, maybe there could be a different standard there because there would be no one living there. It seems like it might be a safer situation. And I understand we have some additional housing units coming along online that'd be great to get some folks into.
Thank you. We are looking at possibly finding a way to inspect affordable units that might be needed for persons experiencing homelessness to get them onto the next step. So we're trying to develop criteria for how we would make that happen. One of the issues that we have, though, is that a final inspection on any property has to be completed by the fire department through the fire marshal. And we are trying to keep our fire personnel away from any kind of situation in which their health could be compromised. And even though there's nobody maybe living in a unit, if the fire marshal is going from one unit to another to do these final inspections, we are very concerned that they will inevitably meet somebody and then that could cause a problem. And because we have, I don't want to say limited fire personnel, but we're just trying to really preserve them for the long term. And so that is where one of our hangups is that our fire response is more essential than final building permits or certificates of occupancy. And we've made that decision, and we're going to try to see if there are small exceptions, but there are not many.
Okay, fair point. Thank you.
Mm-hmm.
Great. So I've got Mary next.
Mary, did you say? So my question, I don't recall seeing this on the order, and if I missed it, I apologize. What is the direction on building permits?
I don't know what your question is.
Well, will building permits be issued or not?
So I'm going to ask Chris, since we had a conversation today with folks over there, maybe you can answer this one.
Sure, Jane, I'd be happy to. So Mary, we have essentially worked to convert planning and development services into an online services center and virtual services center. So our staff has worked to develop a mechanism that we can process all of our permit applications electronically. Of course, we still have a lot of the paper applications in our office, and so we've worked out a mechanism actually to get those paper plans reviewed by our staff. So we are continuing to be able to operate and review and process building permits. I think actually, if I remember the stat I saw in the end of the day report today, I think we did 34 different reviews just today So we're continuing to operate. We're ironing out the kinks with our applicants as we go. All of that information is on the Planning and Development Services website, which is boulderplandevelop.net. And we're continuing to update that page as we continue to kind of improve and smooth out any of the kinks and kind of converting to an online and electronic review process.
Thank you, Chris. And some of the questions that came up since the order was issued yesterday had to do with what's the difference between shelter in place and stay at home?
Well, I guess I'll answer that. The shelter in place language is language that has been used by governors in other states, and it feels very harsh. And so Mayor Hancock, when he worked on the Denver order, wanted to call it stay at home because it seems clearer to people about what they're supposed to do as opposed to shelter in place. And so my understanding is that they chose that language because it was more understandable. The view is that it's the same thing, and in either instance, you've got to read the fine print to understand who has to stay home and who doesn't, but it's very much the same thing.
Thank you for that. And then one more question is, in reading through that and listening to the intent of the order, it seems to me like there's a lot of common sense associated with this. And, you know, we've been getting some really granular questions about, can my landscaper still come over tomorrow? What kind of responses can we give to people? Because those are just so granular. It's like, you just need to use some common sense, I guess. And to what extent are people expected to do that?
Yeah, that came up for me a couple of times today as well. And I do think that people using common sense would be very good. An example I'll give is that a concern was raised with me that some folks are like en route from other parts of the country to move into an elderly care facility here in Boulder. Can they come? Well, yes, their stuff's in the moving van. They're on their way. They can still come. So that's a common sense kind of answer. And people need to be able to do that. But at the same time, people need to stay home if they're not doing essential things. And I think we did get a lot of questions today of people trying to get out of the order and, you know, find a way that their particular situation was an essential service that it kind of wasn't. So hopefully the public health order will help us, and certainly having a more central agency answering questions for the entire county about essential services will be very helpful.
Thank you, Jane.
Junie, did you have something?
Yes, I had a quick question, and I just, again, I know you saw the chat. I just wanted to thank Jane for bringing up the building inspection, because that is something that is important to me and important to all of us when it comes to providing more affordable housing, although we do have a health crisis. So it's a balancing act, and I really appreciate Jane, mentioning that and letting community members know that we're still working on these things. I think my question is about a conversation that I had with a community member, and I wonder if that probably involves our relationship with the Boulder Chambers. So basically, her house is currently being shown by real estate agents. And I know with the shelter in place and the different orders that people are still allowed to go to work, is it possible, what can we do to ensure that people are safe and real estate agents are not coming into their homes, meaning renters? Even though they don't own the property, they live there, but in this current situation where with the virus that is spreading, and people feel like, well, I don't want a real estate agent to be coming to my house, even though I'm a realtor. So what can we do to ensure real estate agents are not coming to people's homes and potentially transmitting the virus to the rest of the family?
Yeah, so we allow real estate professionals to be doing their job. And my understanding is that most of them, well, the real estate group of people have protocols for entering people's homes. And those protocols include wearing gloves and putting on booties, but they're not going to have masks, and so that's the issue. So I suppose that working through the public health order in the next few days, it could be possible that a change might be made or a clarification might be made to require that to happen, but I cannot promise that that's going to happen.
Thank you.
Okay, I don't have anyone else on the queue right now. I guess I will weigh in on a few things. I think this discussion of economics has multiple layers. I don't know if we want to start at the top or the bottom. To me, the questions I have raised and that we heard from Dave Query today and others about rent holiday and rent abatement, they're driven by a need to let people survive without increasing the amount of debt that they're carrying. It seems it's nice that we hear and talk about abatements, but if people end up adding to their debt load through this process in a way that they're not going to be able to work out from under, whether they're individuals living in a rental apartment, whether they're individuals with a mortgage, whether they're small business owners, and so I know that the concept of a rent holiday is one that has a lot of concern around it. And I still think it's important that we speak about this because we need our federal representatives and our state representatives to understand that we are going to feel this pain quicker than any of them are, because these are going to be people who are neighbors and friends who are going to be asking us, what can you do to keep me in place? There are some groups that don't need much help right now and can weather this because they have tons of resources. There are some groups which are going to be on the edge, and 1 month or 2 months can put them out. There are some groups that will be eligible for income qualified types of assistance that many other people will not be able to access. And so I wanted to kick off a conversation around a rent holiday, but it has to be equitable in the sense that we also don't want small landlords to be put out of business by having to give a rent holiday. So I don't know what the answer is, but I feel like we need to be asking the questions because they're going to come and land in our laps here in the next 30 to 60 days in many cases. If you imagine that what we heard from Dave Query is that they had to lay off hundreds of restaurant employees, if those folks, if they get unemployment assistance, maybe that's helpful for a while to them, but if their rent continues to stack up and they have no source of income and unemployment is only covering whatever 40 to 60% of what their income had been before, their workers on tips heavily and tips are gone now. I just want to put in there that I'm deeply concerned that the federal response will be quick enough. I do appreciate both the governor encouraging people as well as our boards promoting election hearings. But I think an important conversation we need to have in our community is what does financial assistance look like and who needs to provide it and what is our having that discussion. It is thought this event is going to cause us to have discussions that we have not had mostly for 80 years. And we had that conversation. I want us to be broadly, even if the answer is no, I don't want us to just have options taken off the table, because that's not the way it has typically come up. So, I think there's a lot of legal questions around this idea, but I just want to make sure it's voted publicly. Our city council meeting, it's been for And this community had started to respond already, but I want people to hear about it and hear as well. So, could people hear me or not?
No, Sam, when you sat back, it was really hard to hear you. It started to cut out.
Okay.
Yeah, I
All right.
caught about 20% of that.
All right, I apologize. I'll just turn it over. I think you guys know the idea that I've had. I've spoken with many of you individually about it, about a rent holiday, and how we need to have a conversation around the way our economy works and who it supports and who it serves that we haven't had for a long time. So did you all hear that?
Yes, yes.
Okay, so Aaron, I got a no from you. From Rachel, I got a not well, and from Junie, I got a yes. Okay, now you can hear. Great. So you heard what I said. Do others have thoughts on the rent abatement, rent holiday question? Okay, I've got Mary at this point and Mark.
So thanks for that, Sam, the 20% that I got, but I think I know what you were saying. I think you're absolutely right in that we need to consider basically both sides of the equation. You've got the renters and you've got the landlords and all the different people within the business, from the people working in kitchens to the people that own the restaurants to the people that are lending to the people that own the restaurants. So all of that needs to be considered. And I think this is the same kind of issue as with at the state level. And my earlier question about how we how the governor said encourage, discourage, refrain. And if we can put some teeth behind the kind of sentiment behind the encouraging and the discouraging and the refraining, I would be very willing to find a way so that people essentially come to the table to do the right thing. That's all I have.
Got it, Mark?
Yeah, I have a few comments. One, I think we need to better understand what the impact of federal and state help is going to be on our small businesses before we go down the path of a rent holiday. And in addition, I am very concerned that we don't have the authority and the power to institute a rent holiday. My understanding has always been that we do not have the power to alter private contracts. We do have the power, if we want to use parts of our reserves to set up some sort of assistance fund for tenants, whether they're commercial or residential. But I just don't know if we actually have the authority to do this. I am also concerned with how we formulate standards so that we're not giving rent relief to large tenants who don't need the assistance, and they're providing, and by the way, there are some residential tenants who may not need the assistance and would be equally entitled to a rent holiday. And I don't think we know enough yet to really go down that road. If we want to look at creating some sort of fund, I think it's worth some investigation and using part of our reserves for that purpose. But I am very concerned that if we simply institute a rent holiday, we will be doing something that's unconstitutional. And I guess I'm turning now to Tom Carr and saying, Tom, do we have the legal authority to tell people they don't have to pay rent under their lease agreements?
Well, Mark, there's certainly challenges with that. There's no case that says absolutely you can't do it. And as you noted, there's a constitutional provision that prevents governments from interfering in contracts. There's another one that precludes a taking by a government. So I certainly think there would be legal challenges, but these are extraordinary times, and you can do what you need to do, and we'll defend it. There are certainly risks.
Just to follow up, I would also point out, I don't know if any of you have seen the email that John Taylor sent in at about 6 o'clock this evening, where he's assembled a number of the largest commercial real estate landlords in Boulder, representing about 1,200 tenants, and they have all committed to a no eviction policy, to work with tenants to either forgive rent or mitigate rent obligations, and are going to do everything they can to keep tenants in place. On the commercial side, it's relatively simple. No landlord who throws a tenant out is going to do better by doing that than by working with them to keep them in place. The economics simply don't work. They're going to lose money on every transaction in which they do that. So there's a lot of movement going on in our private commercial sector now that's directed towards keeping tenants in place. On the residential side, it's a little more problematic, and we need to explore what we can do. But again, I think we need to know a little more before we simply enact a rent holiday.
Thank you. I've got Rachel, Adam, and Mirabai on the stack. Rachel?
Thank you for the suggestion, Sam. And I largely echo Mark's sentiments. I'm a little bit concerned about our authority and the legality of interfering with contracts. And I guess I'd want to know more, how big is our risk? Because if it's a sizable financial risk to the city, I don't know that we can do that. So I think that maybe carrots are better than sticks in this situation. I don't know what that could look like, but I think we should consider it. And then also, again, I think Mark already hit on this, but can we get at the same outcome by targeting some of our rainy day fund to help people who need to pay rent? Thanks.
Am I up next, Sam?
Adam's up next, and then Mirabai. And then...
Thanks, Sam. My only pushback, I agree with a lot of what Mark said, but I think speed has a lot to do with what happens here, because if we nitpick too much and it takes too long, that's why the federal government is trying to move so quickly for once. It's because, if we wait long for the perfect solution, we may lose a lot of the people that we're trying to protect in the first place. So that's my only pushback to Mark's statement.
Okay, Mirabai, and then Bob, and then Aaron.
I, in general, would agree with Mark and what Rachel said, and I think I didn't get to read what John sent over just because the meeting was starting and I didn't have a chance to read it, but if they're willing to work with tenants, I think the use of carrots would be preferable rather than trying to create some laws that could possibly put the city in a lawsuit. So, yeah, to not copy everything, that's pretty much.
Great, Bob?
Yeah, I'm going to agree with Mirabai and Mark and Rachel also. Adam, you made a great point about speed, and I think we do need to move quickly here. I would observe that we know that evictions are prohibited at least until May 31. So we do have a little bit of time here, probably about 2 months. We won't take the full 2 months, but we do have weeks, not days, to figure this out. I think Mark made a great point about we don't know yet what federal dollars will flow to these small businesses and whether there'll be grants or whether there'll be loans. But because the evictions are effectively ceased until at least May 31, I think we do have a little bit of time to figure out where money might come from. As Mark observed, we have commitments so far, and I think they're still coming in from landlords, both large and small, to work with at least 1,200 tenants on the list that we got this afternoon, and I suspect we'll get more. I want to be careful that we don't try to solve one problem and cause another. Many of these property owners in turn have obligations of their own, including mortgages and payments of insurance and maintenance employees and so on and so forth. And if we deprive them of rent, particularly from tenants who actually have the ability to pay rent, we may actually be putting them in a bad situation. And what I don't want to do is pick winners and losers. We should not try to make this zero sum where we're shifting money from one party to another. It is a contractual obligation, and I would much rather have the money, rather than coming from one of the two parties to the contract, actually come from a third party, which is the federal and state governments, which seem to be willing to throw literally trillions of dollars at these problems. And so rather than rush into a solution which may actually cause more problems, my preference would be to allow the process, which is in progress, to work through over the next few days or a week or so. Evictions are stopped. And we should have a better visibility here in the next week or two about whether there are funds available to provide relief to tenants. And that does not impinge upon either the legal or the financial rights of the other party to the lease contract.
And then Aaron, I've got you next.
Yeah, thanks. Well, folks have spoken my mind. I appreciate the comments by Mark and Bob and Rachel and others that I agree with. Just a couple additional things. One is, our affordable housing providers are working with all of their tenants who are struggling and setting up payment plans, different kinds of accommodations, not evicting anyone. But they do count on the rent from those tenants who are able to pay in order to stay financially solvent. So I've heard from multiple affordable housing providers on that point. And then I am encouraged that, in speaking with Kurt Fernhaber, that the city does, as he mentioned, have some substantial funds available to assist with rental assistance for residential renters. So we do have some significant resources that we're bringing to bear on the local front. And of course, we do have that no evictions until May 31st. And then hopefully the stimulus bill is going to provide some real serious assistance for our local small businesses. But I think we should be ready to step in and assist potentially as needed in coming weeks if that is still merited after the stimulus package goes through.
Mary?
Yeah, I just wanted to make a comment about some of the residential buildings, the multifamily buildings. I believe those are considered commercial properties. And I'm just wondering if in the group that the chamber has assembled, there are the high-density residential property owners at the table, and if not, how can we get them there, and can we make sure that they are at the table so that they can also work with their tenants on a case-by-case basis? That's all.
Great. And if no one else is on the stack, I'll return to this since I apparently cut out pretty badly, and point out that I don't want this to be anything that we move quickly on. So I'm not pushing that this get done tonight or in the next week or even 2 weeks. I agree with Bob and Mark that we need to see what we get from the federal assistance package. We need to see whether there's grants in there as well as loans, because again, one of my concerns is continuing to build up debt on people that are not going to be able to meet that obligation, and either they will go out of their business or they'll put other people out of business. So I'm not pushing that we do something right now. I mean, the ultimate carrot, referencing Rachel's comment, would be printing money. It's the kind of relief from the federal government that is only needed once every 30 or 40 years, and I think we're going to need it now. So I just wanted to get it out there. We're in the economic part of our conversation, so I just thought I would raise the issue. I'm happy to hear back from landlords that are making commitments, and that's great that they are, and it's really much appreciated. So I'm happy to close that subject unless anyone else has a final comment. Okay, we're still able to hear.
Where are we?
So I think, Jane, I think we're done. Is that the end, do you think, of the briefing?
Yeah, it's the end of the briefing, and since we already covered the emergency order, I think it's the end of that. The thing that's remaining is last week you asked us to prepare a declaration that the council would sign or would pass that showed strong support for perhaps emergency measures and also strong exhortations to the community about how to help us with our primary goals of flattening the curve, having essential services continue, and equity for the community. And so that has been prepared. Some of you have seen it, and Carl Castillo is going to discuss it if you would like to make any questions about it. So I'm going to turn it over to Carl, and I believe that we were going to try to put portions of it up on the screen. Is that true?
Thanks, Jane. I believe Tom was going to give that a shot.
Okay.
So while he's working on that, I will. I'll just start off by saying that this declaration of, first and foremost, I wanted to acknowledge Alyssa Dinberg, the assistant to the city manager, who really did the bulk of the work on this. I also want to acknowledge that this is both at council's request, but we also had the department directors make contributions to add items that we thought were important. And finally, it does include a lot of the things that the state of Colorado and the governor has been asking for. So it's kind of a consolidation of best practices and things that we're strongly urging our community to do. The declaration was revised to acknowledge the emergency order that Jane signed. I certainly can walk through these. I don't know how to best bring these to the attention of the community, but I guess I'll pause and ask you, Sam, how much you'd like me to cover on this, or if you feel like maybe it's something that would be better situated to coming from you.
Well, I think much of what's in the declaration has already been covered in other parts of the meeting. I would, I guess, only highlight the key parts are how to protect the human health, both by personal hygiene and by social distancing. So beyond that, I don't know that much more needs to be called out here. How do other council members feel?
So this is Mary. I've had a chance to take a look at it, and I am good with the last thing that I saw, which was yesterday.
Okay, and I don't have anyone else on the queue that I can see.
Sam, do you want a motion to adopt the declaration?
I do.
I move that we adopt the. Tom, does this have a number, or is it just the declaration in front of us?
It's just a declaration, Bob.
Okay, I move that council adopt the declaration that is in front of us.
Second.
Okay, are there any council members who object? If there are no council members who object or who want to make any further comments about it, I'm going to take that as unanimous support. Okay, good enough.
Sam, I just wanted to mention it does look like Junie might have a question.
Oh, Junie, what's your question?
Hi, Sam, but you said that's already been adopted. I think my I had two questions because Carl, you mentioned that you were gonna discuss it. I wanted to hear more about who's being protected because we were just discussing commercial renters. And I wanted to ask if there is the opportunity to incorporate small business and commercial renters in there. And also, would it be possible to have it as well in Finnish?
Got it. I apologize, Junie. I thought your comment had been about the previous subject. So,
oh, that's okay.
Carl, do you want to speak to that?
Sure. So 3C speaks about evictions, and it essentially adopts a lot of the language that the governor had used. So perhaps I can read this and see if it begins to address what Councilmember Joseph is addressing. It says all residential and commercial property owners and landlords are asked to refrain from removing tenants or mobile homeowners without cause or as a result of late rent payment or minor tenancy violations through April 30th, unless public safety requires it. Moreover, all property owners and landlords are asked to refrain from imposing a fee for the late payment or non-payment of rent through the end of April. Landlords are encouraged to work together with tenants to find solutions for rent payments and to help ensure housing securities for persons at risk. Councilmember Joseph, does that partly address your question, or is there other topics?
No, thank you. Actually did. Thank you.
Oh, great.
Okay, so it sounds like we have, Junie, just to check in with you, do you support this declaration with what you've heard?
Yes, I do.
Okay, so I think we have unanimous support for passing this. Okay. Jane, do you want to move us through the next part?
Yeah, so I believe the next thing on the agenda is the consent agenda.
Okay, I'm looking here. So we have the declaration. We have an item here which is suspend rules, an item which is special meetings. Are those on consent?
Yes, those are on consent.
Got it. Someone want to move the consent agenda?
This is Bob. I move the consent agenda.
Second.
Okay, does anyone object to supporting the consent agenda? Hearing none, I will declare a unanimous vote in support of the consent agenda.
Okay, and then the next item on the agenda are matters from the mayor and members of council. There are three call-up considerations, and then a discussion about future council meetings and possibly board and commission appointments. So the first call-up consideration is disapproval of the designation of 1202 Folsom Street as an individual landmark.
Great, and does anyone want to call that up? Hearing none, I'll assume no.
Okay. The next one is concept plan review for redevelopment of the property located at 1313 Broadway. And this is the Hill Hotel.
And I assume that we're going to want to take a look as a group. Is there anyone who does not want to take a look at the concept plan for the Hill Hotel? Okay, so I would, Bob, do you want to make a motion to call it up?
Yeah, I move that we call up the concept plan on the Hill Hotel 1313 Broadway.
Second.
All right, we had lots of seconds. So does anyone object to calling up the concept plan for the Hill Hotel? Okay, I think it's called up.
Then the next one is the landmark alteration certificate for construction of a new garage on the property at 2621 5th Street in the Mapleton Hill Historic District.
Does anyone have an interest in calling that up? Hearing none, I assume we won't.
Thank you. Okay, then the next thing is a discussion of future council meetings. And we have in your packet a list of the different council meetings that we have coming up through the end of April. These were all discussed at CAC on Monday, but I'm turning it back over to Sam, Bob, and Adam to talk about the decisions that we made and then for council to weigh in.
Right, and so you can see in the packet what we have kind of laid out going forward. I think one of the big questions that comes up is the library and when and how we want to have the discussion of the library district. And then, you know, if other council members have reviewed what CAC decided going forward, I thought it was important that everyone on council have the ability to weigh in on, is this the work plan that we want going ahead, knowing that we're probably going to have to make changes as the COVID-19 issue evolves.
Sam, I have a question. This is Mary. Is the packet that we have been referring to what was in the CAC meeting minutes that we received yesterday?
So
I'm not sure I understand. Go ahead.
My understanding is that, yes, this is what you received yesterday.
Okay, just wanted to be clear on that.
And if you look at March 31st, we have revisit the work plan as the first item there. So I don't know if there's anything that people want to pre-revisit, like right now, that doesn't look good coming up, but we will have an opportunity next week to digest this and have another discussion about it. Okay, so this brings up one item I had on my list, which is Bob and I have been getting daily briefings from Jane, about 20 minutes long, just to understand what's changed from the previous day. And I want to inquire with Tom and others, can we extend that to all of council, especially if we don't make any decisions but are just asking questions and getting information? Would it be possible to have all of council access those meetings?
I think that would be problematic, Sam.
Okay.
Yeah, I think that's come pretty close to a meeting requiring notice.
Okay. Do you think it's okay that Bob and I are getting briefings from Jane?
As long as there's not a delegation from the council for you to do it, it's fine.
Okay. I hear Mary's on the queue, and then let me look and see if others. So Mary, you want to go ahead?
Yeah, I have a question about, so we've been getting these updates from Jane. How are your briefings different from that?
Yeah, so I'll weigh in if you don't mind. The briefings that, they're actually phone calls between Sam, Bob, and me. And in those phone calls, Sam and Bob ask a number of questions that I mostly cannot answer. And therefore, I say that I will look into those things and provide more information about them. And then they usually show up as answers later in the week. So that's pretty much what it is. Sam has also been a part of phone calls with Mayor Hancock's office, and then he will relate to us information about what he heard on those calls. So those are two of the main things that happen.
So the questions that are asked at the briefings and that you provide answers to later on in the week, are those answers provided to the entirety of council or just to Bob and Sam?
I think they're provided to the entirety of council. So some of them were with regard to homeless services and sheltering and or severe weather shelter. And then of course you got information from me later in the week about those kinds of things. So that's what it is.
So is there anything, question for Jane, is there anything in the briefings with Bob and Sam that are not covered in those emails that we received from you, Jane?
I can't think of any. Like early on last week, the two of them asked a number of questions to clarify some things, and I think that I know that I clarified with them, but perhaps some of them did not make it into the report. I think it's possible that that happened on Wednesday or Thursday. I'm not exactly sure. There was a lot of questions and more information that was desired that caused quite a bit of work for me and staff the next day. And I quickly responded to those. So
I'm going to throw out a suggestion, if I may. And could we try just sending our questions to Jane and having those questions addressed in the reports that we're receiving, rather than having briefings with only 2 council members on a daily basis? All council members can provide questions that are addressed, if not in the very next report, in some report, one of the reports down the road. How do people feel about that?
Can I colloquy on that, Sam?
Yeah, I have a queue. And so, Rachel, if you want to jump in on the colloquy, and then I've got Bob, Mark, Aaron, and then you, Rachel. So go ahead.
Okay, so I echo much of what Mary just said. I'm pretty uncomfortable with 2 council members receiving daily briefings when a lot of us would probably have different questions than maybe those 2 would have. So, and given that we all have equal stature as council members, that makes me uneasy. So can we? And yet, I want to be able to give Jane the audience that she maybe needs. So, can we have these be public updates if it's a problem for us to have us all be on the call, or is there another way to do it where it's not just 2? Thanks.
And so I'm just going to go down the list here because I think there's a lot of folks who want to speak up about this. I have Bob, Mark, and Aaron currently, and then Junie.
Yeah, I actually agree with Mary and Rachel. I don't feel super comfortable. I mean, obviously we all talk to Jane from time to time, but I don't. In this circumstance, I don't feel comfortable having this exclusively be Sam and me. And so I either like the suggestion that Mary made, having council members simply sending questions to Jane, and if they need to be more broadly published, you can always copy hotline. The alternative would be, and this may be less attractive, but I'll just throw it out as an alternative. The alternative would be to do it on a rotating basis. And I do think it's probably important for Sam and Jane to keep connected, because Sam gets asked a lot more questions than we do, just because of the title and also because he's plugged into Metro Mayors and to Mayor Hancock's office and the county folks. So I do think it's important that Sam and Jane keep connected and coordinated. But to the extent that Jane wants to host a daily briefing with 2 council members, I might suggest it be Sam and a rotating member of council. And that, of course, is not mutually exclusive to Mary's idea of us all sending questions to Jane as we have them.
Okay, great. Thank you, Bob. And I've got Mark, Aaron, and Junie.
Yes, just briefly, I wanted to second Rachel's comments. I think we're all desirous of getting as much information as we can and trying to process it correctly. So if there's a way of getting more of us in the information flow, I would like to do that. Thanks.
Great. Aaron, then Junie.
Yeah, I'll agree with that as well. And I'm concerned about giving Jane and staff, overburdening them. So I think the idea of having, I like Mary's approach of having us send in questions as we're moved, and we could just write it to the council email address potentially, so that we all have some visibility on it. And then they can be included in the daily updates, which are incredibly helpful. And then maybe we could just authorize Jane and Sam to speak as necessary as issues come up that are, that Sam might need to know for media purposes, or that Sam needs to communicate with Jane to pass along things from Metro Mayors or Mayor Hancock's office.
Thank you, Aaron. Junie?
Yes, I just wanted to say, yeah, I agree with everything that was said. I am okay with the two-person meetings, whether it's with you and someone else. But again, it's just an issue. Can you hear me? Because I'm hearing myself twice. Hello?
There's a little bit of an echo.
Okay, I hear myself twice. But yeah, I think it's an issue of transparency rather than rank, right? Whether you are, no matter where you work, communication is very important. So I think the daily updates. So after, let's say, a meeting between whoever these two council members are, there's, let's say, okay, here are what we talked about in bullet points. To me, I think that's acceptable. So it's a matter of communication and transparency to me. It's not a matter of rank. But will that burden staff? I think that's for Jane to let us know whether that would be too much to take on as of right now.
Can I comment about that?
Sure.
Yeah, it would be too much to do. The telephone calls, and they're not briefings in my view, occur around 5 o'clock at night, and sometimes they go for 45 minutes where questions are asked of me like, what have we done about rental assistance? What do you think about rental assistance? Things like that. And the information that you have gotten tonight is all wrapped up into that. If I were to try to take notes about those questions and then answer them all, I'd be working until midnight every night, and I cannot do that. So I like the idea better of Sam and I speaking whenever Sam needs to or I need to, and then the rest of you sending in questions.
Thank you, Jane. Anyone else want to comment? Rachel, you were on the queue earlier, but I don't know if your colloquy was all you wanted.
Yeah, it was just colloquy.
Okay. Well, I wanted to bring this up. I mean, the way this got started was Mayor Hancock got us together like 3 times in the course of a week as he was building up the momentum towards this executive order, the stay-at-home order. And so I felt like I didn't want Jane to get blindsided by it. And so I was just trying to keep in close connection with her as things were moving super quickly. I feel like we've moved out of that really quick phase. I think there will be, we have our East Boulder Rec Center set up, a lot of things that seemed like they needed to happen very quickly required more frequent consultation than we had before. At this point, unless there's something that comes up that Jane wants my input on, or I need her input so that I'm giving good information to the press, I'm happy with stopping those 5 o'clock calls every day. Okay, anybody else? Okay, very good. Let me see what else I had on my process list.
Comment.
Go ahead. Okay, Rachel.
Yeah, I have a comment about, so media questions. I would like to just suggest that we spread that around. I do think, to Rachel's point about all of us being equal here, all of the council members are essentially equal, and I understand how other cities tend to view mayors from places where they elect their mayors. They want to speak to the mayor. However, I do think that we should, as a council, see each other as equals and rotate that talking to the media so that when opportunities come up to speak to the media, that we all get to do that, not for visibility's sake, but to provide a representation of the city for the diverse perspectives that we all bring to the council. And so I think also that for new council members, they need to as well get some experience speaking with the media. That's my comment.
Let's see if I've got, Aaron, did you have something? And then Bob?
So if you can just come back to me after this discussion, I had something else.
Okay, and I think Bob did too. So I lost.
I wanted to colloquy on Mary. I agree completely with what Mary said. And Mary, did you get a chance to tape something with Channel 9 today?
I did not tape anything. They called me and we just chatted on the phone.
Okay, great. Now, I don't know how to best to do that. I know that a lot of those media inquiries come through Patrick. And so, Jane, maybe we could just encourage Patrick, as he did today in diverting Channel 9. I think their initial request is to speak to the mayor and eventually went to Mary, which is great. If we could encourage Patrick to spread that around to council members. I don't know if this is a good time to speak about council videos and the op-ed idea Mary had. Do you want to do that now, Sam, or is that later in the agenda?
Well, I think it's now from my list.
Okay, well, I'll just start it, and then, but the op-ed thing is Mary, so I'll let her take credit for it. 2 or 3 of us have already recorded videos, and again, these were requests made by Patrick. It would be great if you have a couple minutes to record videos. I think it would be great if all 9 of us had videos up there. As it turns out, it was pretty easy to do because this Teams app, I guess is what it's called, actually can record as well. So once you put together a 2 or 3 minute script and send it over to Patrick, he can then have one of his people do a Teams meeting with you at a time that's convenient for you. You can sit at your desk just like you're now and do a couple, 2, 3 takes, and then they just post it on Channel 8. And I know, Mary, you did one, and I did one, and Sam, I think you're going to do one, but I think it'd be great. And we all have our different perspectives. I mean, the one I did today was on neighbor-to-neighbor support. And everyone has a different perspective and a different reaction, and I think it humanizes this whole situation. And I think it's important for us to have our faces literally out there in the community, even though we can't host gatherings or meetings. If we can at least post videos and talk about our experiences or supporting the orders that Jane's issuing, I think it's really, really important. We have to use all sorts of media, and these videos are one of them. And then I'll stop and let Mary propose her idea on op-eds.
All right. So last week, I think I shared some information with everyone regarding a webinar that I participated in last week with the American Psychological Association, and it was about leadership in times of crisis. And one of the takeaways, at least for me, was that there's a need to make sure that elected officials, or as elected officials, we communicate with our constituencies. And so one of the things that occurred to me after that was to write just opinions with the camera, and we could either write them in pairs or write them each on our own, just one author, and have them rotating on a weekly basis in the camera. I traded texts with Quentin Young last Friday and asked if that would be feasible and if they would be amenable to that, and he said that that could work. So if we each rotated, say, once a week, that would be every 8 weeks. You'd have to write one, and you wouldn't violate the firm's policies on the frequency of guest opinions that way. And like I said, we could also team up 2 on 2 to do that, just as Sam and myself did a couple of weeks ago. So thoughts?
Okay, anyone want to comment? Okay, Rachel.
Hi, so Aaron just wrote thumbs up, and I would echo that. I like the idea, Mary, and I'm willing to help in any way I can, and to sign up to do my one every 8 weeks. And to Bob's point, I do think it's important that we participate and make ourselves available to the community in a lot of additional ways right now. That's all.
And Mark and Adam agreed with Mary. Mark?
Yeah, I think it's a terrific suggestion, Mary. I'm more than happy to participate, and count me in.
So this is Jane. Patrick has indicated to me that if you do move in this direction, that our staff could review what you've written just for accuracy, if you're interested in having us do that.
Yes, absolutely, Jane. I was going to actually bring that up, that we need to make sure that we are conveying accurate and correct information, because we don't want to be like our leadership at the federal level.
Thank you.
Great. So it sounds like that was the end of kind of my communication bullet points. Jane, did you have anything else you wanted to say about communication?
No, that's fine.
Okay. Okay, well, good. I think this is great. I will try and defer some or all media inquiries to you guys. I will be honest that it's been a little bit of a burden, actually, not necessarily a pleasure, just because there have been a lot of questions and they've come pretty quickly. So I'm happy to share this around. Okay, so Rachel, you have a hand up?
I do, thanks. So I did an interview today with KGNU, and I was noting Boulder Beat. So maybe we also want to take some efforts to ensure that we're spreading it around and not just doing once every 8 weeks to the Daily Camera.
Great, good idea. Anyone else? I think, Jane, am I right? That brings us to the end of our agenda, and we have one more item that we could talk about.
As long as there aren't any more comments with regard to the upcoming agendas.
Yeah, I think there were, actually. I skipped over one of those by accident. So Bob, you had said something about you didn't think we should do the e-scooter hearing.
Well, I actually have a lot of questions about the agenda. So let me just ask a process question. Are we going to review the entire April agenda at the March 31 meeting? If so, I'll just be quiet and save my comments for then. I don't actually endorse everything that's on this list right now, but if we're not going to talk about it tonight, I'm fine with that. But I don't want my silence to imply that I agree with everything here. So if this is the point of disagreeing, then I can be disagreeable.
Yeah, I'm going to jump in for a second, if you don't mind, because next week we'll probably have another COVID briefing. And tonight it took at least 2.5 hours to get through that. And so that would leave quite a number of other matters on the agenda for March 31st. Scheduling of the library district item, I don't know how long that would take. A discussion regarding initiative petitions and whatever board and commission appointments you have not yet done, plus revisiting the whole calendar. So I'm worried that if we say we're going to do it next week, we might not actually get to it because things are taking a long time.
Yeah, anyone else have thoughts? Rachel?
What?
I'm sorry. I'm losing track of where I am here. Hang on a moment. So I've got Rachel, Aaron, Bob in the queue. Rachel, you may have already said what you intended to.
I did, yep.
Okay, Aaron, you're next, and then Bob, and then Mark.
Thanks. Well, I'll echo Bob. I'll just be just a little bit disagreeable tonight, and rather than hold off. I mean, I would really encourage CAC to take a really sharp pencil to the agenda that we have in our packet for tonight, because I think the COVID briefings are taking a long time, but I think they deserve the time, and I think that's where our focus should be right now. So I think the things that are not extremely time sensitive, I would recommend that they get put off more. So for the meeting next week, I'm sure there will be new developments on the COVID front. I'd like to spend the time it takes to ask the questions on those, and then maybe we have a couple of those other things go away.
Okay, so then I've got Bob and Mark.
Yeah, I'm going to agree with both Jane and Aaron. I think this COVID briefing took almost 3 hours, And I have no reason to believe that we're not going to have another 2 or 3 hours of new information next week, and probably another 2 or 3 hours of new information each week for the duration. This is fast moving. It's scary. We've got great partners who are sharing great information, not only with us, but more importantly with our community. And that's got to be absolutely our number one priority. I mean, I see council's primary responsibility right now is to be a facilitator of communication to our community. And I really literally see nothing on the April agenda that has to happen that's anywhere close to as important as what we talked about tonight. And so I can go through item by item, but I got to say that 80% of what's on the April agenda, I would take off the April agenda. I tried to do that a little bit at CAC, and I think we had some disagreements on CAC, and so that's why we thought we'd bring it back to you guys. So we can do that item by item tonight. We could do it item by item on March 31, or you can just give us a general direction to do a better job. But I would really cut out a lot of stuff here, and I could go through specifics if people want to, but I don't think we should take the time tonight.
Okay, and then I've got Mark and Rachel.
I agree very strongly with Bob on this. This is absolutely not the time to be focusing in on e-scooters. I'm not even sure if the library district rises to the level that we ought to be focusing on it. We are primarily positioned to be facilitators and communicators to the community on what's going on in a once-in-a-lifetime, I hope, situation. And I just, frankly, I don't even want to focus on some of these things. It's not our job at the moment. Our job is to provide answers to the community, provide reassurance where we can, and kind of work our way through this disastrous situation. And I'm entirely with Bob on this.
Okay, great. Now I've got Rachel and Mary.
Yeah, sorry to double dip here, but I agree that our job is to stick to the essential functions that we have, and that's what we are asking community members to do, to pare down things that are not essential. And there's a lot that we can put off that is not essential that has to be done now. And I mentioned this last week, but I'll reiterate it. I don't think the community or ourselves need to see us fight or fight with each other right now about things that will certainly be contentious, because they always are on city council. So I don't think we're doing the community any favors if we pick up topics that we're going to argue and bicker about. I think we stick to essential and role model sticking to essential duties, and that some things really can be delayed, because right now we're focused on health and safety and saving lives.
Okay, we've got Mary and then Adam.
So I would agree with what Bob, Aaron, Mark, Rachel have all said, with one exception regarding the boards and commissions appointments. I thought that I saw somewhere, I believe it was when I started reading the report from Jane today, that boards and commissions are now going to be able to meet remotely. So I think that we need to move forward with that. And if there were one thing that I would put on the agenda for March 31st, would be the boards and commissions appointment, and I would take all the other things off.
Okay, so Adam, you're next.
Thanks, Sam. I agree with Mary. The only thing I would say is this is the time to start thinking about ideas that we can bring, that we may need to work on in the short to medium term, that are going to mitigate some of the impacts. I think you all saw an email I sent to you about a couple ideas that I had, so I wouldn't shy away from bringing up ideas at this point in response to the COVID crisis.
Great. And then as I'm tracking here, we've got Aaron Brockett agreeing with Mary, and then Mirabai has a question.
Yeah, so Mary just said that boards and commissions were going to be able to meet via video, which is great. I guess my question is, with staff being as thin as they are and stretched thin, and us kind of on hold with items, how's that going to work? I mean, are they going to get way far ahead on issues, or is it going to cause staff to work on issues that don't really need to be working on right now? I guess this is for Jane, so I just kind of an understanding if we're kind of on pause
Yeah, so let me jump in and try to answer your question. At our staff agenda meeting earlier this week, we had questions about some things that boards and commissions need to get done. So an example would be the Arts Commission has funding that's been appropriated by the city, and they need to meet in order to award those grants. And of course, at this time, it would be super helpful to those artists to be able, and organizations to be able to get those grants because maybe other revenue is not coming in. So that was an example. I think the Liquor Board may be one that needs to meet. What we thought was going to happen is that on April 7th, you all would keep the docket that we had here and that we would try out a public participation with the council for the first time in that April 7th meeting. But if we're going to pare it down and get rid of the dockless bikes and the e-scooters, then we probably will not have a public participation portion. What I said to staff is that the week following April 7th, so that's the week of April 13th, we may begin to do boards and commissions with public participation because we will have tested it with council. So to get to another part of Mirabai's question was, does staff have the capacity to do this? We would be holding only board and commission meetings where there was something important that needed to move forward and that we had staff capacity for. So we were thinking of starting with the Transportation Advisory Board because they have some matters to take up. And I think we also said Open Space Board of Trustees. We also are going to have the Council Process Committee on CU South Boulder Creek flood mitigation, I believe is trying to set up a meeting for later this week. Our plan had been to get to the Water Resources Advisory Board, the Open Space Board of Trustees, and the Planning Board before like the first week in May, because we still have that scheduled for a study session for council to make some decisions on May 25th. So we were going to be considering whether the process committee will be considering this Friday whether or not that needs to move forward in that fashion. So I'm sorry that that was such a long answer, Mirabai, but we do have some capacity to be able to hold those meetings, and we would only do ones that we thought had a matter that needed to get decided in the near term.
Thank you so much, Jane.
Great, thank you with that. And a quick question, this is Sam, a quick question for Tom. Tom, wasn't there a little bit of urgency on the e-scooters just in the sense of extending the moratorium?
Yeah, the moratorium, yeah, we need to bring, I think we have that back for April 7th. We could just do the extending the moratorium on consent if you wanted to do that.
Yeah, and so that's,
I think it expires on the 21st or the 12th or something of April.
Yeah, and so some of the things that you still see here, we were hoping would be very short items. You know, there were just issues that some reason or another needed tended to, and we thought we could get them done quickly. As we look at March 31st, my thinking around revisit work plan was not to look at the work plan for the next year or two. It was really to look just ahead at the next month or two, figure out what we need to get done. I think there will be council members who want to move flood mitigation forward, even in light of where we are now, and I would agree with that. So it doesn't be a 2 hour. I think it could be a 30 or 40-minute item. We all weigh in on what we think is and strike.
Sam, we're losing you again. Lean forward if you can.
I'm leaning forward, so I'm trying not to use my video either. I tell you what, let me go back. Mark has a comment, and let's just see if mine comes back. And I saw Mark, Aaron, Mirabai. Oh, that's okay. So Mark and Aaron.
No, Sam, you're incorrect. I've already said my piece.
Okay, and Aaron, I've got you at 9:40.
Yep, thanks, Sam. Just a couple additional thoughts. In terms of like the e-scooter thing, like that's one where, for example, we could just do as Tom said and extend the moratorium rather than having a public hearing where we talk about longer term next steps. because that I think would require some discussion, and we probably don't need to focus on that right now. So that's an example of maybe how we can tighten things up, is just to do the time-sensitive thing and leave the bigger discussions for later. And then just one little process thing with the Teams meeting that we're doing here. We have this meeting chat, and I think it's handy to be able to throw in a real quick comment in the meeting chat, but sometimes it's substantive rather than just a, hey, call on me. So you might think about Sam as the moderator. If you see a little comment from one of us in the chat, you could just read that out loud to make it part of the record.
Great, I appreciate that. So to that end, Bob had a comment that he agreed with Mary on boards and commissions for March 31st. I'm going to say that I agree with that as well. Mark Wallach said he agreed with Mary as well. Were you guys able to hear that?
Yes.
Great. I will get a headset for the next one of these, I promise. I thought I'd solved my problem, obviously not. As far as March 31st goes, are we believing revisit the work plan on there? So, does anyone object to leaving revisit work plan for the next 2 months on there? Okay. Does anyone object to board and commission appointments on March 31st?
I'll just chime in again that I think it's going to be us bickering at a time when we really don't need to bicker publicly. That was Rachel.
Yeah, no, I got that. Would you have an extension as far as us extending the terms of current members?
Sure. I don't know the protocols here, but I think that as the state house shut down when it was dealing with urgent business, we can also shut down on some things that are not pandemic related urgent business, not health and safety related. And
I think Tom has a comment on that, on the continuation of terms.
Yeah, I remember last week we discussed the charter provisions about board appointments are pretty specific. It's Section 130 of the charter, and it says that you shall appoint them for 5-year terms. There's no provision for extension. Again, we're also kind of in violation of the charter because we were supposed to do it at a regular meeting in March, and that's not possible. I think that there should be some understanding of the unusual circumstance here. So it's really up to you, but I do caution that there really isn't a provision in the charter for extension of terms.
So for me, I would say this is not as big of a risk as, interfering with contracts say. This is something that feels a little bit low risk to me, and I would stick to health and safety. That's all.
It is a crime to violate the charter.
Is it really? I'm sorry to laugh.
Yes, it is. There's a provision in the charter that says violations a misdemeanor, but I don't think anybody's going to lock you up in charter jail.
Okay. So I've got Bob and then Mark.
Follow-up question for Tom. Tom, could we just on consent next week, if it was the will of council, I do take Rachel's point, and I think it's going to be a lengthy discussion, and there'll probably be a couple of points of disagreement. If it was the will of council, could we simply reappoint all of the outgoing incumbents for until the replacements are identified, and that could be 30, 60 days. Obviously, if we have some incumbents who don't really want to serve, they don't have to show up in meetings. We can't force them to, but assuming that most of them are willing, and as Jane said, we're not going to have all these boards and commissions aren't going to meet. It's only going to be select ones. But to the extent that we have willing servants, could council simply do on consent next week or at some point in time a short-term reappointment of those whose terms would otherwise expire?
So I would not advise doing that, Bob. The charter says that they serve until replaced. So if you do nothing, their terms don't expire.
Well, that's even better. I thought that was the answer. So if we just did nothing, then they would continue to serve until we identify their replacements, whether that's March 31 or some later date.
Yes.
Oh, that's better.
Mark?
I think that's an excellent solution. And I agree with Rachel that on this, I'm prepared to take the chance of our gross illegality. I've always looked good in orange, so that's I'll take my chances. And it's certainly a lot less consequential than declaring rent holidays when we don't necessarily have constitutional authority for it. So I think this is a great solution, and we ought to put it into place.
Aaron?
Yeah, I have a preference for the direction that Bob and Mark and Rachel are going in. So I would let the existing people continue and then wait a little longer on the appointments. So that would be my preferred approach as well.
Okay, so then to recap, on March 31st, we revisit the work plan for a few months. I haven't heard people weigh in on scheduling of the library district item, so I think we need to get at least feedback on that. Adam, you're next.
Yeah, I had one more thing to say about boards and commissions. It's just, oh, sorry, I lost my point for a second. You can pass by me for now. I'll come back to it if I can remember. Sorry.
Okay, I've got Bob and then Mary, and then Rachel weighed in with I'd skip library district 2, and then another for Mark. So let's go to Bob and then Mary.
Yeah, well, first of all, I would probably tend to agree with Rachel that I'd skip library district, but I'm not sure why this is a process point. I'm not sure why we're calling library district out as a special item. I know that we were meant to deal with it, I think it was last week, and so it's a carryover item, but it really is part of the whole work plan. In other words, we need to talk about library district and e-scooters and everything else that's on the list. I think that's part of work plan. I have an opinion about it, which is similar to Rachel's, but we could talk about that next week.
Okay, Mark and then Adam. Oh, I'm sorry. Mary, I just skipped you, I believe.
Got it. So I just wanted to just one more time try at appointing boards and commissions on March 31st for the reason that we don't know much about this pandemic, but one of the things that we do know it's that it's going to get worse before it gets better. And we're going to be going forward in time with less and less and less of an appetite to do any of these things. I think this is one thing that we can do that we could just get done. We need to get done that while things are still fairly fresh in our minds, I don't think that we're going to bicker that much. We maybe on 1 or 2 boards, but I just don't see us bickering. We really never have bickered much on these appointments. I can think of one time in my years of being on council where we did bicker. And so I'm going to just plead with you all to just consider doing it on March 31st before things get worse and we have even less of an appetite.
Thank you. Mark, you're next, and then Adam.
Yeah, I'm happy to treat the library district as part of the revisiting of the work plan, although I find it difficult to believe that we can really discuss it in any knowledgeable way without a better sense of what our financial circumstances are going to be. And otherwise, I agree with Rachel again on boards and commissions. I just don't think it's the thing to do at the moment. Thanks.
I've got Adam, and then I'm going to read what Mirabai says. It's fine with me to do what Mary requests. So Adam, you're up.
Yep. So in terms of boards and commissions, if we do, extend it to an unknown date, I just suggest we give some sort of guidance for the applicants if they want to withdraw, or, we should just tell them what's going on as best as we possibly can so that they can figure out their options. I assume too that the pandemic is probably going to create a lot of uncertainty for people who are currently on the boards. So if we get any board withdrawals, we'd probably want to know that as soon as possible. it's just a very dynamic time, so we may want to check in on our boards and commissions in general.
Got it. And then I have one here that I don't know how to interpret. It's from Mark. It says, I agree with Adam's suggestion. So Mark, why don't you jump on and tell us what you agree with?
What I agree with is informing the applicants of where we stand and what the situation is, and give them the opportunity to withdraw if that's what they want to do, or stay in the game, and we will get to it as soon as we can.
Got it. Okay, and I'll weigh in. I'm fine with rolling library district into the work plan discussion. So I think March 31st actually looks like COVID briefing, work plan, and then I would also do the board and commission appointments. I agree. I can only think of one particularly rough session of appointments in my 6 years, but it doesn't seem like that's the will of council at this moment. So what I would say that we do is we think about it, my proposal, we think about it for a week and we come back, and as we revisit the work plan, if we decide regarding boards and commissions that there's still a majority that wants to put them off, then the conversation becomes, okay, what do we tell them? And if the will of council is we make the appointments on March 31st, then we make the appointments. And so just watching how the last two meetings have gone, my guess is that if the COVID briefing takes a long time, then we probably will only have the bandwidth to revisit the work plan. So, and I am fine with punting the initiative petitions to a later meeting. Does anyone want to try and keep, or maybe that's just part of the work plan as well? Okay. So members of CAC, Bob and Adam, do you feel like we've gotten enough agreement and enough clarity to be able to go forward on Monday?
I do.
I do as well.
Okay. And I'm going to assume from the discussion we've heard so far that we won't do board and commission appointments of any kind tonight. And so that will just be something that we talk about on Monday. Any objection to that?
Nope.
Okay. Well, this was an exciting council meeting. Thank you all for helping us and our community think it through. Any final comments, Jane, staff, council members?
I don't have any final comments, but just thank you for a great meeting, and we got a lot of good information that we gave you and a lot of good comments that you gave us. So we're working really hard and we appreciate your support so much. Thank you.
Great, Jane. I've got Aaron and then Rachel on the docket.
Well, just want to say I thought it was a very productive meeting, and this is a city organization and city council I'm really proud to be a part of. Thanks, everybody.
Okay.
I just wanted, sorry.
No, it's you. You're up.
I will read Maribai's, which is pretty much what I was going to say. Thank you, staff. We really appreciate you. You guys have done a great job of teeing up virtual meetings and making this possible. So thank you, Jane, and all of your staff for all this work. And look forward to next week.
Great. And I've got Mary.
I want to echo the gratitude that has been already expressed by my colleagues to staff. I think you guys have been just totally a super fine group of people, just impressive as can be. So thank you for that. And I also want to thank the community, and I want to ask the community to please concur with the stay-at-home order, to use common sense about what is and what isn't essential. I think that many of the folks that emailed us wanting to know whether the specific situation was essential or not probably know somewhere in their hearts whether it is or it isn't. So I would just ask that they look within their hearts, look at the situation, and realize that this is not a time to do things about me. It's a time to do things about we, and to think about the collective good, to think collectively and to act collectively. For many Americans, that's not typically in our repertoire, but I think that we can summon that here in this community. So thank you.
Great, thank you. Mary, I've got Bob and Mark Wallach.
Wow, Mary, that was really eloquent. It's hard to follow that. I agree with you completely. Jane, I just wanted to pass on to you, in addition to the thanks that you've heard from my colleagues, I've been monitoring some blog posts by various National League of City committees. Of course, cities around the country are struggling with exactly the same thing we are. But my observation is that they are, most of these cities are many, many steps behind us. They're struggling with things that we were talking about 2 weeks ago and 3 weeks ago. And we really are leaders in this. I know that the partnership with Denver has been very strong. The partnership with the county has been strong. The partnership with our governor has been strong. But I just wanted to let you all know that our staff is doing stuff that staffs in cities around the country are just starting to think about now. And so just know that while we're on really uncertain ground here, and some of the stuff we're kind of making up as we go along, we have absolutely the smartest people leading us, and they're making the best decisions they can with the information they have, and I think most of those decisions are actually good.
Thank you, Bob. Thank you. I've got Mark.
Yeah, two thank yous. One is to our staff. They are leaving me in awe at their ability to be responsive and thorough and innovative. I know they're working very, very hard, and they are doing an extraordinary job in the worst of circumstances. And Sam, I also want to say thank you to you. It can't be an easy job to moderate this kind of forum and this kind of meeting, and I think you did it very, very well, and I appreciate your efforts.
I appreciate that, Mark, and I just want to add my comment here too. You know, I am, like Aaron, proud to be serving on this council. Everyone is stepping up and helping the entire community think through what we need to do next. I agree with what Bob said, of course, about how great our staff has been, but about how far ahead we are. And, you know, we have great partners. Thank for that, the county, the state, and our region. Different players in the region are kind of approaching this differently, but, you know, together we can do this. And I appreciate all of you, both council members and staff. So thank you.
Thank you.
Okay, with that, if there's no more comments, I'm going to declare the meeting adjourned.
Thank you. Bye, everyone.
All right, take care.
Thanks, everyone. Stay safe.
Thank you.
Take care.
Good night.
Live from Paris, Soft 24.